works on my phone, but not my computer. This is wild.
Oh, I can see you clearly.
That thing also happened to me. It worked on my phone, but not on my computer. Just FYI.
Okay. Good evening.
Our majority leader.
Good evening, everyone. My name is Melly Rosado. I'm the council president for the Court of Common Council for the City of Hartford, and welcome to the fourth evening this week of our OMBGA budget hearings. With me this evening, and I am just going to announce my colleagues the way I see them on this, Councilwoman Marilyn Rosati, Councilwoman Shirley Sargent, Councilman Gale, Councilman Sanchez, our majority leader, Councilman Clark, Councilwoman Wildalise Bermudez, and I believe that makes up for Council, who's on our screen. Also this evening, we're joined by our CFO, Jennifer Hockenhall, along with various departments and staff who will be presenting this evening. We are currently streaming through Facebook Live, channel 96 of Comcast, and channel, I believe, 6032 of Frontier. This evening, each department will have 30 minutes to make their presentation, followed by questions from my council colleagues. This evening, first will be Health and Human Services, followed by Human Resources. Board of Ed was scheduled to present today, but they will be presenting next week. And last but not least, Families, Children's, Youth, and the Recreations Department. So with that, I am going to turn it over to our CFO, Jen Hockenhall. You have the floor.
Good evening, Council President and Council members. Nice to see you again tonight. I look forward to hearing all the presentations, and I'm going to just turn it right over to Liani, our Director of Health and Human Services. Take it away, Liani.
Great, thank you, everyone. It is a pleasure to be here with you this evening to do a presentation on for the department. I just wanted to be clear, is someone actually going to be turning the slides for me? Or
no, you have the presentation to share your screen.
Okay, can you give me a second then? Because that I did not pull up, so sorry about that.
No need to apologize, take your time.
Liani, I have them if you'd like me to run your show.
That would be great, just simply because my computer is very slow right now at a time that it doesn't need to be slow. I would appreciate that.
I have too much open now. Sorry.
It's okay, Director Arroyo. Today, I think we're all experiencing a little bit of technical difficulties, but we'll get there. Thank you.
Okay, thank you. Thank you, Carmen. So again, apologies about that misunderstanding. think the top one that does the slideshow. Do you have it on top where it says the slideshow, Carmen? Go up. There's a little screen. There you go. From the beginning, yes. We're much better at public health than we are at PowerPoint, as you can tell in Zoom. So thank you all this evening for having us here. The Department of Health and Human Services is really pleased to present our budget and to provide you an update on what we've accomplished, what we would like to accomplish, and what we have yet to accomplish that we had hoped to this year. So first, I definitely want to say thank you to my team that is here to support this presentation and has been pivotal in getting this budget and getting this presentation done. So we have Tu Nguyen, who has our city epidemiologist, who has served as an acting deputy director for me during the pandemic. Carmen Chaparro, our project leader, who's also doing the slides for us this evening. She oversees the budget office here in the department. Mohammed Kordi, who's a new addition to our department as a management services officer. He backs up Carmen and works and interfaces with our state, on our state contracts with the State Department of Public Health, as well as Monique Dunstan, who's our nurse supervisor. And it is also National Nurses Week. So I want to say thank you to her for all the work that she's done for us during this pandemic and all the work that she continues to do here in the city of Hartford. So thank you, Monique. We are actually in the middle of a clinic right now. It's open hours for vaccination here in the city of Hartford. So she's doing a little bit of double duty. So as you can see, the first slide is the mission of the department. Go back a slide, Carmen. Yep. The mission of the department, as you all know, is we aim to protect the well-being of Hartford residents, promote an environment conducive to healthy lifestyles, and we work to prevent adverse health outcomes through using needs assessment and quality services. Next slide, please. This is a flow chart or org chart here in the department. We consist of 5 divisions. Those divisions have numerous programs. Some of those programs are general funded programs, as you can see in green. The other programs, in red, programs that are funded by both grants and general fund are in green, and then anything in blue is a grant funded program. As you can see, we are a department that does have a large reliance on grants. Some of those grants are yearly, some of those grants are multi-year grants. All of those grants have expirations, and we are expected to compete on either a yearly or every sort of set period of time basis. And then I do have one in purple, I call it a special project, which is our COVID funding that we've received, that it really goes under all of these divisions, because all of our divisions have a role to play as it relates to COVID response in terms of either modifying operations or assisting and moving general fund staff around when needed, and really being a partner to all of the team to be able to get everything done. In terms of staffing, our staff consists at this point in time of 64 individuals. That includes some temporary staff that we've brought on as a result of COVID for the vaccination program. So of that, 33 are Hartford residents, so 51.6% are Hartford residents. We had set an internal goal in the department last year of 50%. So I'm very pleased that we were able to meet that goal of having over 50% of our staff here in the department be Hartford residents. In addition to that, when we look at a demographic breakdown, almost 50% of our staff is Black, 46.9% of our staff identifies as Black, 8 of them are men and 23 are women. So we have a lot of Black women here in the department. The next largest group is Latinos of 32.9% for Latino men and 17 Latina women. The next group is our white population, Caucasian population. We have 3 men and 5 women. And then we have the Asian population, which consists of 2 men and 1 woman, and then 1 individual who identifies as other. And that's also 17 male for 17 17 men and 47 women. Next slide. I think that the big picture for that is I feel like for the most part, we are very representative of the population that we serve. Next slide, please. Thank you. So I think many of you have seen this since I've been director. I've included this slide as something to help everyone understand what the Department of Health and Human Services does. Essentially, we look at the 10 essential public health services, and that is what we aim to provide. And so I'm going to use these 10 essential public health services to give you an overview of what we've accomplished as it relates to COVID this year. So we have monitored daily the health status of our community. And at this point, we have seen in the city of Hartford over 89,000 COVID tests conducted, over 16,000 cases, and unfortunately, nearly 300 deaths in the city. That work of monitoring the data has continued daily since the pandemic began. We have diagnosed and investigated COVID cases since the beginning when we received our first case in March of 2020. Thus far in 2021, we've had 5,991 cases, of which we have attempted to reach nearly 99% of them and completed a first interview with 63% of them. And then we have had 1,305 contacts. We've attempted reaching 99% of them and have completed interviews, at least one interview with 78.8%. We have informed and educated and empowered our community and our business owners. We have worked with community-based organizations to find funding and provide funding to community-based organizations to bring on community health workers to do outreach to our community and provide information and ensure that our community has access to information as well as access to testing and access to vaccinations. We've worked to develop policies and plans working with our city HR department on coronavirus policies to ensure that city functions can continue, but that our staff here at the city of Hartford were safe and we're coming into a safe environment for work. And we've created plans that constantly change due to the changing conditions, plans for vaccination, plans for testing with partners. And a lot of that work has continued. We've enforced laws and regulations throughout the pandemic. We've continued food service inspections, really COVID inspections. In the first 3 months of this year, we've conducted over 200 COVID inspections of businesses and of restaurants, and that's on top of the regular food service inspections that they conduct and the other work that happens in the department as well. We've linked people to much needed services. Prior to the state initiating their community resource coordinator program, we were working with our staff here in the city of Hartford and then with the CDO staff, our community health workers, to ensure that we were doing some light for the individuals that were quarantining or had tested positive, connecting them with food resources, up to and including delivery of thermometers, PPE, as well as food. And we continually evaluate. We have looked at the data, as Councilman Clark knows, because we partner closely with Charter Oak. We're looking at the data. We're making recommendations as to where we need to move resources, and that's been testing, education, door knocking, vaccine clinics, and that evaluation on a constant basis of what we're doing is critical to our work. And then research. We are continually looking for new information, new and innovative solutions to the challenges that we face here in the city of Hartford as it relates to a multitude of issues, but in this case right now, since we're doing a tale of COVID as it relates to COVID. And so one of the things that we did that was something that we had been thinking of trying was, we know that there are many individuals in our community who may not want to come to a vaccination clinic, but may be likely to come to a community health fair or a community party or community block party like our colleagues in the recreation department are doing. And so we did that this weekend in Bravo Plaza, and we had 61 individuals come out, overwhelmingly African American and the majority men who would not likely otherwise have been vaccinated. They came out and they were vaccinated because we partnered with a local radio station to do a live feed. And so we continually look at things that we can do in order to make sure that our community has what they need and has the information they need to and access they need in order to make decisions that work for them and their families. Next slide, please. So you went too far. Go back. Yeah, there you go. In terms of some highlights, and all of these highlights are current as of April 27th. And so when I have the new information, I'll let you know. We have hosted actually over 73 vaccination clinics. Those are clinics including our Dunkin' Donuts clinic, our clinics here at the health department, as well as clinics that we hosted in the community. We were one of the first to go out. The first week that we were vaccinating here in the city of Hartford, we actually went out to a senior housing development that was extremely hard hit by COVID deaths and by COVID cases during the pandemic, and did on-site vaccinations. So these 73 clinics, or over 73 clinics, include the over 32 mobile clinics that we've conducted as well. So those are things that we continue to do. We have vaccinated actually over 9,000 individuals. We are actually at 9,511 individuals, and over 61% of them were Hartford residents. That's 5,822 Hartford residents that we have vaccinated. And as of yesterday, that accounted for 1 out of every 6 Hartford residents was vaccinated by the city health department. We've also vaccinated over 278 homebound individuals. That's probably closer to 300, if not over 300 homebound individuals. And those homebound individuals are coming to us through home health care agencies, through self-referrals, and through the state. With hospitals, FQA, our federally qualified community health centers, and the State Department of Public Health to ensure access to vaccines for our residents. We have successfully competed for nearly $2 million in COVID-related grants. That number has since increased almost double that. We're in negotiations on a final number with the state on a grant, but it will be nearly double that in COVID-related grants that we've been able to successfully compete, and we have about another $4 million outstanding that has not yet been awarded that we're waiting to hear back of. In addition to everything we've done with COVID, we've also hosted 6 flu vaccination clinics. We knew that there was a possibility of there being the twindemic of flu and COVID overtaking our hospitals, and so we worked and partnered with the United Way and with the Ministerial Health Alliance and other partners in the community to host 6 vaccination clinics, as well as provide funding and opportunities to other organizations to host vaccination clinics. And lastly, one thing that we're very proud of, if the COVID work wasn't enough, our team successfully submitted their application to the Public Health Accreditation Board. I think most of you that have been on the council have known that for the last 3 years, this has been a pending item for the health department. And so we actually successfully submitted our application, and we'll be moving forward in that process. And so if we're able to do that, able to achieve accreditation this year, we may be the first of the state's largest 5 cities to achieve accreditation. So that's something that we're working for. Next slide, please. In terms of strategic initiatives, we still have COVID to deal with, and there's still a lot of work to do with COVID. Our states are not where they should be, nor where we want them to be. And so we know that we have to continue that work. We have to continue to bring the rate of COVID down in our community as well. And so we'll continue to use the funding that we've received through competitive grants, as well as grants that we've been invited to apply for, to fund community-based organizations, to be extra boots on the ground in the community. They can get into places that we can't get into as a health department, and we'll continue to do that. One thing that we do in any grant that we apply for is put funding towards CBOs, and as well as funding towards building the capacity of the department so that we can respond more nimbly and more quickly to issues in the future. Another thing that COVID brought out, we know that we've had an issue with rodents for pre-COVID, and that issue became dramatically worse during COVID for lots of reasons, and it was not something unique to the city of Hartford. It was something that was happening across the country. And so we continue to look at that and investigate and research new and innovative ways to deal with that. And so we transitioned from teen pregnancy to rodent pregnancy prevention. And so we recently deployed the use of rodent birth control, essentially, as a pilot with funding that we have from a grant to see how that works. And we'll be moving that around the city to hard-hit areas where we may be unable to place rodenticide or unable to place the dry ice that we just started using as well in the past year and a half. And then lastly, one of our goals is to achieve that accreditation. And as I mentioned, if we do achieve accreditation this year, it is a long process. It is an external board that comes in to review the processes that we have here in the department, the work that we're doing, how we account for that. And if we do achieve that, again, we would be the first of the state's 5 largest cities and would join 3 other cities in the state with that designation. Next slide. So in terms of a comparison, here you see what was adopted, what we're recommending this year that does represent an increase. That increase is due to some grants that we will have as a result of COVID that will last into the coming year. Some grants that we have just recently received, it's nearly actually over $2 million in grants that we've received, $2.5 million in grants that we've received in the last about 6 weeks are not represented in this amount right now because they did come in later after this was submitted. So these are grants, some of our grants will end before the end of the fiscal year that we've received for COVID, and others will start once the fiscal year starts. But this represents an increase in the majority of that fund, if not all of it, is really related to COVID and the work that we've been able to do and the funds that we've been able to raise. You know, other things that we will see, you know, there is some uncertainty around whether we'll be able to keep those grants, but we do and will continue to go after grants. That's something that we do on a regular basis. Next slide, please. So in terms of other budget highlights and areas of focus, COVID response will continue. We expect that we're going to have to continue this work definitely through the end of this year and into next year. We know that at this point in time, there will be booster shots. What those booster vaccines, when they will come down, what they will look like in that process has yet to be determined. We know that there's a vaccination of children that will be occurring, of older children that will be occurring, likely starting as early as next weekend. And so we are working on plans for that and to be a part of that. We know that we need to continue to have testing and contact tracing. So we'll continue to do that work. So COVID response does not end at the end of this fiscal year. In fact, it will continue with us likely through the entirety of the next fiscal year, if not more. Funding, you know, we are a department that likes to be innovative, likes to try new things, and doing that requires new funding. And so we'll continue to pursue new grant opportunities as they arise. An internal goal in the department is to apply for 2 new grants a year. And we decide on the grants to apply based on a number of things. If there's something that we're currently doing that we're doing well, that we think if we get more funding, we can expand, we'll look at that. Or if there's something new that's arising that we need to address. And so we'll look for funding on that. Focus on systems building, that's something that is a holdover from last year. We think that's critically important. We had intended to do standard operating procedures for different things in the department. We were unable to do some of that this year because of COVID, but we want to continue that work. And so some of the positions that we have in the department will be moved towards working on some pieces of that so that we can have that done by the end of the fiscal year. And I think as everyone has seen, there does definitely need to be a prioritization of social determinants of health. We know that our city was very hard hit by COVID for many reasons, many of which are connected to the social determinants of health. Many of our community members could not work from home. They had to go in. They had to go into work when there was not necessarily enough PPE available at the beginning of the pandemic. And then as the economy reopened, they had to go back to work when rates were still in some cases going up. So we know that we need to look at that and work with our sister departments here in the city when we can work together to identify how we can partner and work to ensure that social determinants of health are being addressed so that when there is another pandemic, because we know there will be something else that will come up in the future, that we are ready and that our city is not as hard hit as it was at this point in time. Last slide, and that's it for our presentation. That was less than 30 minutes, so you have more minutes to grill me. I should have kept going, but so I'll stop there.
What can I say? I can stay here all night and compliment you. First of all, I want to say how proud I am of you with all of your accomplishments, going above and beyond, putting us out there in the map. The job that you have done and continue to do is exceptional. And let me not say that you being bilingual is a double add-on for us at the City of Hartford. So I want to congratulate you for having a diverse team, staff, and which is truly a reflection of the City of Hartford. So thank you for that. And you know, here at Council, we're here to support you so that you can have any tools that you need in order to be as successful as you are and accomplish all your goals and get more of our people out there vaccinated. So with that, thank you so much from the bottom of my heart, and I'll open it up to my council colleagues. Majority Leader Clark.
Thank you, Madam President. Through you, Director Arroyo, what can I say? Excellent job. You know, we have worked closely together, and I don't see that changing anytime soon. And you're absolutely one of my favorite directors. The work that you and your team have continued to do has been great, and kudos to your team that are present with you. Two things. I noticed that there's a tremendous amount of I think it was like 20% that you said that was a part of your budget for that was COVID grants. Do you, and I might be wrong with that percentage, but do you foresee that is that going to be sunsetting anytime soon, and is there going to be something else that come behind that to actually assist with the efforts in decreasing this the rates as we continue on in the pandemic?
So I'm not sure it's as high as 20%, but it's definitely a good portion of our budget. But I will say that some are sunsetting. We have 2 grants that will end at the end of one at the end of this month and one at the end of the fiscal year. And both of them were fairly large grants. One was $50,000 and one was $400,000. But we also brought in a $629,000 grant during that time period, another $300,000 grant during that time period, and the one that we're negotiating with the state, which is, you know, probably close to $2 million, maybe less than that, that we're negotiating. We also know that the state, some of these funds are multiple years, some of them are short time periods. And so what we've done is sort of layered and used the ones that are going to end sooner first and continue to apply for those grants. So we do know also that FEMA is reimbursing. I believe it's at 100% for this vaccine work. So we will continue to use that as a resource as well. So I think we're in a good position in terms of budget between grants and between the FEMA reimbursement to continue our work.
That's excellent. The $2 million grant that you just spoke about, is that the vaccine equity one?
Yes, it's not officially 2 million. We gotta enter some negotiations about some things, but it's in that neighborhood.
Okay, perfect. And also too, I'm just concerned about the how to support your team in the reach department. Because I think that that's something as we continue on in this pandemic, we know that a lot of these known social determinants of health that were present have now been 100% increased, and I would say exposed to a lot of folks that really didn't know about it or weren't paying attention to it. So I was wondering, what really are you looking to add on anybody to your team to help out with tackling some of these social determinants of health?
So our REACH project is, we're in year 2.5 of a 5-year project, and we'll be able to reapply. I suspect that there will be a no-cost extension on that, just because so many of us were unable to use all of the funding because of COVID. But we are actually looking to expand that team with the funding that we have and the carryover amount that we've requested. So we will be increasing staffing on that. Increasing outreach. The goal will be to really knock it out the park in this next 2.5 years, 2 years that we have left, to set us up for refunding on that particular project.
Perfect. And one more question. Out of the categories of social determinants of health, which one outranks the others?
Ooh. You're gonna ask me that question. Having done education work, I think education and health are inextricably linked. And if you have health and you have education, you can work and you can move forward. And so I think for me, when I think about the work that's happening and the partnership we've had with Hartford Public Schools, as well as CREC this year to keep schools open in some way, shape, or form, which, kudos to the superintendent and the work that was done there, because Hartford Public Schools, with very few instances, only on a school by school basis ended up going remote, but as a system never went fully remote like other places. I think is critically important. And so the work that she'll be doing, I think is really interesting over the summer, and that learning loss. And I think that's critically important when I think of social determinants of health, what's important.
Okay, thank you so much. Again, great job. It's been a pleasure. And please don't hesitate to reach out to us if you need anything.
Thank you.
Councilwoman Bermudez,
Thank you so much.
followed by Councilwoman Rossetti.
Just wanted to say again, you've done phenomenal work, and we really appreciate everything that you and your staff has done through the health department, and especially during this crazy year that we've had, and in other years as well. My question was related to those who are displaced because of fires, and recognizing that the health department handles that, and recognizing that we have a lot of renters who don't have rental insurance. I'm wondering if you could give us an update in terms of if there's been like a pilot program, or maybe even with the new funds that are coming in at the federal level, if we could do something to assist in that front, so that, because a lot of renters, as we all know, don't even think or note that they should have rental insurance, and then that's a cost that's incurred onto the city when they are displaced because of fire. So if you could just speak on that. Thank you.
Sure. So, we've not investigated that as a possibility. What I will say is that in the work that we do, in the work that really the fire department does first, and then we come in, the fire department does it more from the prevention standpoint. We do it more on the back end. I know that the fire department, when there is a fire and people are displaced, they will canvass the neighborhood, not just that immediate block of where the fire is, but a sort of larger radius, giving information about smoke detectors, about renters insurance. So I know that work is ongoing in terms of getting that information out pre-fire. And then when folks come to us post-fire, we are also doing that education about the cost being, quite not as extravagant, I think, as most people think it is. It's a relatively low cost overall for what people are provided in a situation like this. I will say this year we have been lucky. There have been many smaller fires, but there have not been many large fires. And so I think we've seen a reduction in the large fires. I think a year ago, we had a large fire, a major fire, 20 or more units every quarter in one fiscal year, which really wiped out our budget. But we will continue that work, and I think there are opportunities to do better jobs at that. And I know that 311 has been trying to do that as well. So I think there's likely some opportunities there for us to partner to get that information out. If you don't own a place, might not know about insurance. So you're right, we can do some work there.
And again, thank you so much for all of your work. You guys are amazing, and you rock. Thank you.
Thank you, Councilwoman Bermudez. Councilwoman Rossetti.
Thank you, Council President. Director Arroyo, or Doctor, as I like to call you. I don't even know what to say. I think back to a year and 9 months ago now, when we had our last Health and Human Services meeting, and you said, we just need to we need to be calm. Little did we know what was ahead of us. And we handled it with your guidance and others in the city in a way that I still look back and I don't know how we did it. With my day hat at the open house, what you were able to do with us and continue for months I know for a fact saved men's lives. So, you know, thank you, thank you, thank you. I almost don't want to ask you any questions about anything else because I know how hard your team has worked on so many things. But for me, one of the things that I really always have an ongoing, you know, interest and concern about on page 26-5 in the budget book.
What was that again?
26-5, the maternal and child health, that we're going to be able to increase the proportion of pregnant women who receive early and adequate prenatal care in order to improve birth outcomes and to improve infant health. I mean, that is so important to have a good start. Can you explain a little bit on how we're going to be able to increase that?
So sure, thank you. So the work that we do is really through home visitation programs. And so that is a program that is actually out for bid right now. And essentially it is a home visitation program for women to connect them to prenatal services, connect them to our WIC services, and connect them to SNAP and other services that they might be eligible for, while also providing them an opportunity to share their frustrations, ask for help, and really be connected to community resources. And so the number of women we serve varies year by year. It's really, it's not a requirement to be a part of it, but we do work with our WIC office. And if our WIC office finds someone that they believe may be in need of our services, they will refer them to us and we'll work with them. We're also partnering the city along with the village and numerous other organizations such as Hispanic Health, Family Life, Hartford Hospital, St. Francis, came together about 2 years ago to jointly put a proposal into the State Office of Early Childhood to fund a more robust home visitation program. And so, that whole process is in negotiations right now with the state as well. So that's another way that we can amplify that work. And then lastly, we also have a Healthy Start worker that is funded. And each of these programs has a little bit of a different flavor as to who they're reaching out to. Our Healthy Start workers primarily looking for African-American women to reach out to. Our MyApp program is women across the board, and we even sometimes serve women that are not from the city of Hartford, not many, usually about a handful or so, but that come through our WIC office who are really needed of being connected to services. And so that's really how we do that work. Through the MyApp program, we're very happy to say that we are now year 2 of 0 infant deaths. Year 2 of 0 infant deaths. And again, 1 death in the city of an infant can increase our infant mortality pretty dramatically. But in our program, we have seen that we've had 0 deaths in the last 2 years and only 1 death, I believe, since I've been here in the last 3.5. So the program works. The women are happy. They receive services. They receive oftentimes, if they don't have car seats. We connect them with the diaper bank. We connect them with the food bank. And a lot of the work now is really trying to make sure that these women, we stay with them or at least connected to other programs of the city, including the program in partnership with the village, and that they stay connected to WIC, because a lot of our families after the first year drop out of WIC, and we're continually trying to get them to stay in because they're eligible to stay in until the child is 5 years old.
One last thing, Director Arroyo, do we know why they would drop out of WIC?
So the WIC has programs where you have to come 4 times a year, and that can be sometimes a little onerous. And one of those times you need to bring the child. So sometimes some of the parents may find that challenging, particularly if you have multiple children, to bring them all in. So that's why we do a WIC in the community. We've partnered with Head Start programs to actually bring WIC recertification and WIC visits to Head Start. So that way it's easy. We've partnered with community health services to do that as well there. So we're trying to find different ways of being out in the community to be able to do that. And then we also are working with breastfeeding, and we are working on to bring in 2 peer educators on part-time basis also around breastfeeding, which we know helps increase the bonds. For us, we want to make sure every child is fed, but if we can support breastfeeding as an option while continuing the mom on WIC for a food package for herself and other children that may be in the household, that's what we want to do.
Thank you so much. Thank you.
Thank you, Councilwoman Rossetti. Councilman Sanchez?
Yeah,
Can't
yeah,
hear.
you guys hear me?
Yes.
want to echo the sentiments from my colleague. You did a tremendous job. I think the city's been blessed to have you as the director of HHS, and especially with the gift of having a second language, which is Spanish, so that you can reach out to our extended community. Um, so thank you so much. I do have a question about the rodent program, and that is because I have to deal with it as an outreach person at my job. And, I was wondering, have you engaged with contractors, maybe through the DPW and the MDC? And I think there's also through the development services, we have contractors that are on the list. And one of the things that I realized during, while doing my job is that when they start tearing up the road, it forces these rodents to start traveling downstream or upstream into different neighborhoods, and then but there's no type of plan where they can control the rodents prior to digging up the roads. And they also travel, not only through the storm system, but the sanitary system. One thing I did learn is that dry ice, for not sure how, but I guess they eliminate these rodents as well. Okay, so you know what's going on there, of course, with that. All right. So I just would like to suggest to engage with these contractors. If you need, I can always volunteer and help you on that. I know quite a few of the contractors that work in our city. So just shoot me an email and I'll get that information for you as well.
Great. So contractors are required to submit a rodent control plan prior to any digging or anything happening. And so we know that they've don't have the recent data on that right now, but they have done that. And I know that it has been, DDS does require them to do that. So I think the issue that we have to deal with, and we do have a rodent group that's now meeting, a cross-departmental rodent group that's meeting, is just doing more of the follow-up, making sure that we're more proactive and ensuring that they're actually following those plans. And so that's what we're working towards, to be able to do that. Because at this point, they submit the plan, we'll look at it, say, okay, this is fine, this is reasonable. Sometimes we go out and look at it if we're not too familiar with the area or exactly what they're doing, and say, no, this is not acceptable, or this is fine. But I think there needs to be more follow-up in doing that. And so that's definitely something that we're working towards. If we get a complaint, we go out. But as I tell my team, I don't want to be complaint driven. I want to be proactive. And so we're working towards that. Absolutely.
Okay, so then, so if I receive, because I have received complaints in the southwest corner, which was, rare to hear that it was some kind of infestation of rodents. And I believe that was the construction going on the Britain Avenue, still ongoing. And I guess development services, or maybe your department, went out there and addressed it. So when I do get more emails, then should I just send it to you directly to HHS, or still development services?
I think sending us an email, but I also believe including 311 on it is critically important, because if we see multiple complaints coming through 311, it also, prioritizes that for us, right? There's not enough hours in the day to get to everything in a way that we want to. But if we do see multiple complaints, we would go out. But when there is construction and we have been called, we definitely have gone out to inspect. We inspect to see if there's burrows. And on the dry ice, we have been using dry ice for about a year now. The closest dry ice vendor is, I think, Brantford. So we plan to be able to use the dry ice, but we have been working on dry ice, and we use the dry ice in places where DEEP says that we cannot place rodenticide because it can get into the ecosystem, or there's a presence of other small domesticated animals or even wild animals that could potentially get into. So we have been using dry ice. We're using the rodenticide, and we're using different rodenticide than what we used to do. We're applying it in different ways. But COVID, really made the rodents come out. It was something that was happening across the country. Restaurants were closed. They didn't have the normal food sources that they normally had. People were home, so they were producing more garbage. And we had a rodent inspector tell us that they were seeing one of rodents fighting with squirrels for acorns. That's not something that they normally eat. So yeah, it is a problem, not unique to us, not unique to city living, and definitely not unique to a city that basically buried a river where they like to live. So I think there's challenges there that we have to address, and that's why we need to be innovative and working more closely with our partners at Development Services and at DPW, which is what we're doing. We have now a task force to address this issue.
Okay, I agree. Real quick story. I'm talking to my friend on Broad Street about 2 in the afternoon. It was 3 of us, and here's this huge rodent, at least 12 inches long. It was massive. Just, walking right by us with no fear,
No
very
fear.
bold. So
I felt like I was in Boston, Councilman Sanchez, with the rodents this year here in Hartford. Even in my, I live in the West End, and yeah, I saw quite a few of them in the broad daylight. I had to do a double take to see if it was a cat or a rat.
yeah, they're not afraid anymore.
No,
Thank you.
so but we will work on it. Like I said, initiated a pilot project. We started at Bushnell Park because we know that there's going to be lots of activities happening in Bushnell. So we wanted to start there, but we will be expanding that program throughout the city. We've purchased the bait boxes already. It's in the budget to continue to purchase the birth control for them. And so we're going to continue to do that program and move it across the city to see how it helps, particularly in areas where we know it's really challenging to bait or to put the dry ice.
Okay, and thank you and your team for all that you do. Thank you.
Thank you, Councilman Sanchez. Councilwoman Surgeon.
Thank you, Madam Council President. Director Aurora, I want to commend you and your entire staff for the yeoman's work that you have done. Excuse me, my voice is going. The work you have done for this pandemic season. I think when the pandemic happened, you and your staff jumped in there. There was lesson learned, but you guys were able to overcome new issues that we learned as we went along day by day. But it took a lot of time. I want to thank you for a lot of the meetings you held in the evenings. After working all day, you were still educating the community in the evenings when they call and ask you to get on a Zoom meeting. So I know there's a lot that we asked of you and your staff, and I want to thank you so very much for hanging in there with us. And saying that, I didn't understand when you were talking to Councilman Sanchez regarding dry ice. So how does that rodent program work? That's new to me.
Sure. So I always tell the story when I first said yes to the mayor. Thea reached out to me at the time and said there were 3 issues you are going to be critically important to your job when you get here. Teen pregnancy and unplanned pregnancy is an issue that the mayor is interested in. And so we had a long-standing program in that. Opioid prevention and opioid abuse, and that's something we're still struggling with, but we're to sort of hammer away at that. And rats. That's what she said to me. So I learned a lot about rats in my first 6 months here, and we even sent a person to the New York City Rodent Academy. So that was an adventure for that individual as well. And that's where we learned about dry ice. So essentially, dry ice dissipates. And so the idea is to put it into the burrows, it dissipates, and it essentially suffocates the rodents.
Oh, okay.
So it suffocates them. And so if they were to come out and die outside of the burrow for whatever reason, it's not getting into the ecosystem. The hawks aren't eating it. So anything that we do with rodenticide or anything that has to do with rodent control is highly regulated by DEEP here in the state of Connecticut. So that gives us another tool to use in an area that where there might be children, where there might be other small animals, where before we couldn't do anything because we couldn't apply rodenticide. And now we have that. And now we have also the bait boxes for the rodent birth control.
So another tool. Thank you. In your budget hearing, let's move changing to that. Now that I know about rats and rodents, okay. Are you saying that you went your whole pandemic COVID season without a deputy director?
I had an acting deputy director Mr. Nguyen, who is our city epidemiologist. He's been
Okay.
with us for over 20 years, but he is an acting. And then I know that that is a part of my budget for this upcoming year to find a permanent deputy director.
Okay. And so what department did he, was he associated with?
Mr. Toon is
Yes.
in my department. He's our city epidemiologist.
So was he from the health, I mean, what division? I apologize.
Oh, administration.
Okay.
And the administration division. So he's always worked closely with me. He's an over 20-year city of Hartford employee.
Okay. And then you're asking also for a management service officer.
Yes. So I think one of the things, as you noticed in our budget, we are a very grant heavy.
Yeah.
Some of those grants are as little as $25,000 a year, and some of those grants are as much as $3.1 million a year. A $25,000 a year grant from the state of Connecticut takes as much work as a $3.1 million grant from the federal government. And so what we learned during the pandemic was it was nearly impossible for Carmen and her team to be able to do all of the work that was necessary on a regular day, sort of pre-pandemic, no pandemic happening, and then adding the pandemic to that. And so our inability to get some things done on time was hindering other departments as well, primarily finance, to be able to get the FEMA stuff in and things like that. And so we worked with the mayor's office and HR and the finance office to find a position that made the most sense. And so management services officer made the most sense for our department. They're number two to Carmen as a project leader of that. They'll be doing some HR functions as well, because remember, in the midst of all of this, we were also still hiring people, onboarding people. And I think one of the things that's important to know as well, we increased our department size by 50% with the addition of the CDC staff. We brought on 30 additional people into the department. They weren't paid by the city, it was paid by an external grant. And so we needed people to manage that, to onboard people, make sure they had what they needed. And so it was really, really challenging to be able to do that with the team that we had in place. Our finance team was essentially 3 people. So we increased it, or 4 people, we essentially increased it by 1 additional person to help us manage this process and manage the grant flows that are coming in.
And I don't understand how you did it all.
I don't think we do either, but somehow we managed.
Yeah, you guys did. Wow. And with page 26 too, you have decreased the number of staff in your environmental health position.
So we're in the process of hiring. We have many open positions. Our environmental health unit, it can be challenging to hire for. So for food service inspectors, you're required to have a 4-year degree in a science-related field. So that makes it challenging. For rodent control, you have to have the pesticide certificate. We ideally, if not, we will hire you and help you get the pesticide certificate. So those are things that we've done. But in this year, we've had some challenges with the environmental health sanitarian position. So we've had to hire trainees, and we currently will be posting for some additional positions. Every effort is made in these positions to try and bring in Hartford residents. And so we're working with the on pipeline issues to avoid having as many empty positions in that department or in that division.
Sorry, as I look at your output and your effectiveness and your measures, I'm looking at for your food class license for 2021. I know we were kind of in a lockdown, so it appears that people are still taking out food licensings.
Yes, so we still issue food licenses.
Wow.
We some of those are temporary ones, some of those could be permanent ones, some of them could be seasonal ones, but there are still food licenses being issued throughout the pandemic. Absolutely.
Yes, I see that. And pretty much you were issuing about 357 in 21, 594. So you were still doing a lot of work while you were managing this pandemic at the same time. And then when I looked at your the inspection, because a lot of the restaurants and I'm sure a lot of the business were closed. So when I looked at the 59% of inspection for your class 4 license, I figure that's pretty low because of the business being closed at that time. And I'm sorry.
So we were also doing COVID inspections, and some businesses were late in paying for the year. So there was a whole host of things that occurred that led to that number being down. And so we are working to collect on some of the businesses from this past fiscal year that might not have paid to become current so that they can be current for the upcoming fiscal year. And we've noticed an increase, if I'm correct, Toon, in the number of individuals that have paid for this year thus far at this point this point last year.
Oh, so they're renewing their license and paying. Oh,
Absolutely.
awesome. That's great. And now let's talk about, I guess, with the rat issue, the public nuisance inspection. When I looked at you, I couldn't believe you guys were still doing, over 1,000 inspection or intend to do over 1,000 inspection, for 2021, especially what you've gone through. That is amazing.
So, we have to, right? That's a part of the work. If we want to get rid of rodents, we have to also do these nuisance inspections.
Yeah.
And so that is something that we work closely with. We are going to be moving also to Acela, so that's going to help us have better ideas. Some of these, just to be clear, are probably repeat inspections. We have some properties that are repeat offenders and that we'll be working on in this next year. But yeah, our team does do quite a bit. They're out there, some proactive, some reactive. But all of this is data that they're reporting to us and that we do follow up. Some of these are supported as well by the letters that we issue. Everything we do initially is a conversation. And then if there's no action, we will issue a notice of violation.
You mentioned Acela. You're going to be going on to that program. What is that?
It's a database that we'll be using to track the inspections per inspector and the inspections per week, per month, and also, frankly, by areas of the city. So if we're starting to see that we're slacking in one area of the city and there's more complaints about a certain thing in that area of the city, it will allow us to really deploy our resources. When we talked about the evaluate piece of the 10 essential health functions, that's what that's going to help us with.
Okay, great. Well, Director Aurora, I just want to thank you very much and please let your staff know, that the council really appreciate their support in working with the residents through this very difficult time, but things are looking up. Looking forward to working with you the next budget. And I know you guys are going to continue to do a great job on behalf of the residents of the city. So thank you so very much, ma'am.
Thank you.
Councilman Gale? Thank you, Councilwoman Surgeon, for your questions.
Thank you, Madam President. Good evening, Director Arroyo, and of course, I second everything that everybody said. I heard you indicate that you had 64 employees, and in looking at the charts, I see that you were budgeted for 78, so that sounds like you're, and you did mention you have a lot of vacancies. You're down 14 vacancies, and you're looking to increase that 78 by another 7, which would give you then 21 vacancies, or 21 positions, not new positions, but 21 positions to fill. And so I wonder if you could just talk about that a little bit, as well as talk about the fact that you, and I think you sort of touched on this, but in environmental health, you're looking to actually drop 2 positions. And I trust those are not 2 positions that are dealing with rats, since we've had so much conversation about rats. So if you could just talk about those vacancies a little bit.
So I have to look at that. We're not dropping any positions. Last year, you increased our funding for, and we decided to use it for inspectors. And so we did bring on, we increased increased 1 food service inspector and 1 nuisance inspector. So we have had some shifts in people. People have left the department during the pandemic. So I have to double check that in terms of the actual number of positions. I did not project that there was. I'll double check that with Jen and see where there might have been an error in terms of the projection of positions. Many of the other positions that we have are grant funded. And so we're hiring for a lot of grant funded positions. Some of that funding just came in. And so that's why there are a large number of positions that are currently available as well.
Okay, well, I'm glad to hear that we're utilizing all of our our rat funded
Yes,
positions.
yes, yes.
And just one other question then. And this has to do with the ordinance that was passed on nail salon inspections. And I'm just wondering if you've been able at this point to begin doing any of those inspections, or if that's still in the holding period.
So it is in a holding period, and so we moved to the Acela program. The Acela program is supposed to bring everything on board there. Right now, everything would have been tracked through Excel sheets, and with the pandemic, things are quite challenging. But our plan is to, in the new fiscal year, once we get through food service licenses, we will be fully on Acela. And the plan has always been that that will be a winter program where we will do those licenses in the late fall, early winter, so that it doesn't overlap with food service licenses. So my team has told me that they're on track to move forward with that. But the lack of a data system with all of this information was challenging when we were trying to implement. And so we know that Acela had been pushed back a little bit, but now it's back on track. And so we're getting back on track to restart that process and restart the whole update the materials that we did create for nail salons and hair salons, and start that process for the licensing as well.
One last question, if I may. I recall there was some issue with needing people to have certain certifications in order to address a certain aspect of the rat problems. And I'm wondering if that's, if we now have some redundancy built in on that score.
So it's not as easy as that piece, but we do have some individuals in mind that we're working with to take the courses and take the exam to be a secondary supervisor for that. Absolutely.
So we're working on it. We're not there yet.
We're not there yet. You know, there's some union issues that we have to also look into because it's a management position and the other positions are not in the management union. So we'll have to work through that with HR. But we had been in conversations with one particular staff member who unfortunately left to another municipality and took a job over there to start that process. And so now we're going to start conversations with a couple other employees here internally that we have that are good candidates to do that.
Thank you. You're on mute, Council President.
Councilman Clark.
Thank you, Madam President, through you. Liani, just a couple things I forgot to mention. One, I know that there was an initiative with your department regarding the health of Black men. And I wanted to know, was that going to be continued? Is there any funding within this budget to continue that? Because a lot of those social determinants of health are really affecting the Black men that live in our city.
So that work has come through our Ryan White program. And so they have partnered to continue that work. We provide some funding from a small grant that we have to help sponsor some activities. This past year, they did do, or actually about a month ago, it's coming up, the Men of Color Conference. So some of those things will continue to happen. This is now in its second year or third year that they've done something. So I suspect that they will continue. But a lot of that work comes out of our Ryan White program. Okay, great. And also too, you know, some of my favorite people on the face of this earth, which are our seniors. I'm concerned about their nutritional value since COVID, as we continue on COVID. Would it be possible to implement outside of the Meals on Wheels program to have some type of extra food delivery service to our seniors so that they can get back to some of the eating that they used to like and experience? So we are working towards reopening the senior centers. So that we held our first meeting today with with the senior centers. So we will be moving towards that. So I hope, you know, I'm not going to say like in the next month, but we have a target date for midsummer to reopen fully, and that will address some of what you're talking about at that point in time. I will say, even through the Meals on Wheels program, we have connected seniors that have said, you know, we want more fresh fruits and vegetables. We have connected them with Food Share. We've done food deliveries. We've done a lot of that work as well. We are not trying to leave anyone behind. And we've addressed any issues like that that have come up. Our CHWs have delivered food. When we were doing, at one point, we were doing all the meal delivery from our department. So we tried our best to partner with Food Share and the food banks to make sure that if there were individualized sort of food requests that were happening, that we were meeting those needs.
Okay, thank you.
Director Arroyo, I have a follow-up question. My office has been getting calls, and I've been getting calls about the Arroyo Center. The Arroyo Center is it still a rapid test center?
Testing and vaccination.
Okay. So
when y'all gonna get it back?
Huh?
When y'all gonna get it back?
Yes.
Yes.
I mean, you know, we have even the elderlies that used to do Zumba, they want to use the computer rooms. And so I know that last year they were going to shut it down. They extended it and now they are extending it again. When can the community have that center back?
So I know that my colleague Kim Oliver will be coming. And so that's something that she and I can discuss. I know that she is wanting to increase the programming. We've already had that brief initial conversation about what can and can't happen or what can and can be done. And so, you know, I will work closely with her on this, as well as with the mayor's office, who's been instrumental in bringing some of these resources into the community. So I completely understand that the community wants to get back, and I think no one more than Kim knows that the community wants to get back into Arroyo. So we'll work closely, and I did get the phone call today. So Kim, I was going to reach out to Kim tomorrow just to set up a conversation to see what can be done, and work with CVS to see what can be accessed while they're still in the building.
Wonderful, thank you so much. I believe there are no other questions from my colleagues. Let me switch my screen. There being none, thank you. Enjoy the rest of your evening. And thank you to your staff for that excellent presentation. And now I am giving the floor back to our CFO for her next presentation, Ms. Hockenhall.
Thank you, Council President. Up next is our Human Resource Department, led by Interim Director, Ms. Marlene Fleeting. Marlene, the floor is yours.
Good evening, Madam President and all members of Council. Thank you for your time and the opportunity to present to you this evening. My name is Marlene Fleeting. I am currently serving as Interim Director for Human Resources. I have been with the city for 20 years. I started as a cashier in the tax collector's office and have had the pleasure to serve this great city in various positions throughout my career. I would like to thank Mayor Bronin for this opportunity to serve as Interim HR Director, which allows me to present the Human Resources budget for FY22. I would also like to thank the HR department staff for their hard work, commitment, and support, some of whom are with me this evening. Now we will get started with the presentation. The Human Resources mission statement.
Could you share your presentation, please?
Sorry, here we go. Can you see it?
Yes.
Okay. The Human Resources mission statement is: the Department of Human Resources is committed to providing effective guidance and support to all city departments with respect to hiring, managing, developing, and retaining employees. By establishing human resources policies and procedures, the department provides fair, consistent, and clear standards to be applied by the City of Hartford as an employer. The department provides direct services in the following areas: compensation, classification, benefits, employee relations, labor relations, training and development, recruitment, and HR technology. In addition, the department serves as a resource to department heads and city administration on matters involving collective bargaining agreements and state and federal employee law. The Human Resources Department is structured in 4 divisions. The first division is administration, which includes the director an executive assistant, which is currently vacant, and an administrative assistant. The second division is employment services, which consists of 8 employees, 2 of which are new in the FY22 budget. The third division is employee and labor relations, which consists of an assistant director and a principal HR analyst. The fourth division is our benefits administration, which consists of 3 positions, one of which is vacant. We have a total of 16 full-time positions in this budget, 11 active employees, 5 vacancies. Within those 5 vacancies include 2 new positions for FY22. I also have a part-time deputy over employee and labor relations. The HR breakdown for staff is as follows. We have 27% that are Hartford residents, 55% are minorities, 73% are women, which equates to 8 women, 2 African American, 2 Hispanic, 3 Caucasian, and 1 Asian. 27% are males, which equates to 3 males, 1 Hispanic, 1 Caucasian, and 1 other. Again, I would like to take this time to thank the entire HR team for working tirelessly throughout the pandemic to ensure that HR provided support to all employees. HR worked closely with HHS to advise management on proper protocol to keep our employees safe during the pandemic. I would also like to note that the HR department has been through a major transition in this past year, and most of the team is new to the city. Yet, we were able to pull through together and accomplish the goals of the department. There are no doubts that this team will continue to excel moving forward into FY22. And now let me provide to you some highlights from FY21. In public safety, by the end of FY21, HR staff will have completed the examination process for firefighter exam, which included a written exam, 294 participants, a physical agility exam with 214 participants, and an oral exam with 157 participants. We also conducted police officer written, physical agility, and oral exams, and a new class is anticipated for May 2021. We also completed emergency services dispatchers and supervisor testing with anticipated hirings this fiscal year to address critical staffing needs. In the non-public safety, we received and processed over 70 applications for the maintainer 1 position. We also conducted 5 performance exams of 22 candidates for maintainer 3 and maintainer 4 series, which resulted in 4 promotions and an anticipated total of 8 new hires. COVID related, we hired approximately 40 temporary employees to assist with the COVID isolation shelters, the elections, and COVID vaccines. With training, over 1,470 or 92% of city employees completed sexual harassment training as of April 2021. ADA and Connecticut Relay training for 51 employees. We also completed training for public works employees, 190 participants in a safe and culturally sensitive workplace environment training. We also had supervisory training and upward mobility for 22 participants. We had stress management training for 178 participants. In the area of technology, HR created the HR Beat newsletter, which is distributed to employees on a monthly basis. We successfully implemented Target Solutions, which provides more than 1,000 diverse training modules for city employees. We continue to expand the use of various HR technologies to streamline HR processes and provide real-time data. In our benefits administration and labor benefits, the highlights are as follows. With COVID, our benefits administration team supported all city departments with COVID-related matters to minimize the impact on department operations, including but not limited to the following. We successfully implemented and managed the federal FFCRA program, as well as the Mayor's Benefit Program, which covered first responders not covered under FFCRA. With Trinity Health and City Payroll, coordinated, managed, and processed 781 city employee COVID cases. Despite the COVID pandemic, the HR benefits team successfully implemented over 100 virtual employee wellness initiatives, including but not limited to the following: Men's Health Series for DPW and police, nutritional seminars and contests, coaching and mental health campaigns. Fit Body Strong Challenge. 50 employees have participated to date, with another session scheduled for June. If anyone is interested, by the way, the email just went out today from our benefits team. Healthy Wage Weight Loss Challenge. We had 39 participants in Healthy Habits Bingo. Virtual employee benefits webinars such as Voya, Solutions EAP, Wellness Concepts, and Cigna Health, and our on-site wellness coach, approximately 2 to 3 a month. Mental health communication campaign and private one-on-one health coaching. In employee and labor relations, we established and conducted monthly meetings with the city unions, which have resulted in collaboration on department priorities and COVID-related matters. This additional forum allows for open dialogue and union employee concerns, which translates to formal grievance avoidance. Successfully resolved and closed 19 of 44 grievances and 2 of 2 labor board complaints to date. Fair and equitable fire contract for the period of July 1, 2020 through December 31, 2024. The human resources strategic initiatives are to negotiate collective bargaining agreements that are fair and equitable, to partner with departments to prioritize the hiring of Hartford residents, particularly within public safety positions, to update policies and departmental procedures, to provide mandated and optional training opportunities to city employees, to automate HR systems to reduce administrative burden and increase organizational effectiveness. The human resources budget comparison from FY21 and 22. The recommended budget for FY 2022 is $1,730,419. This reflects an increase of $271,055 or 18.6% compared to the FY 2021 adopted budget. The primary drivers of the increase are the additions of an administrative assistant and assistant HR director positions. Additional fundings for required promotional fire and police testings and non-personnel increases, which will allow the department to implement further automation of processes and provide a variety of essential and voluntary trainings for all employees. FY22 budget highlights are 51% of FY22 budget is allocated for recruitment and testing. Effective implementation of additional training will support potential favorability in employee relations driven budgetary expenditures, such as EEO, CHRO issues, and grievances. FY22 budget includes additional funds for contractually required fire and police promotional testing, continued focus on technology, and additional staff to ensure the delivery of quality human resources functions and services in support of operating departments. The human resources budget highlights and areas of focus are to continue to focus on ways to attract Hartford residents for jobs to the fullest extent possible, with a focus on diversity, inclusion, and representation at all levels. Focus on opportunity to improve workforce and succession planning in order to effectively address retirement and other City of Hartford employee transitions. Continue contract negotiations with HPA, Local 1716, and HMEA. These contracts expired in June 2020 and June 2021. Continue to encourage and engage all City of Hartford employees in ongoing training opportunities, including EEOC, ADA, diversity, inclusion and workplace sensitivity, OSHA, supervisory, reasonable suspicion for drugs testing, and sexual harassment training programs. Explore City of Hartford employee recognition program opportunities and more regularly recognize employees for the value of their contributions to the city. Continue to review processes, policies, and procedures and implement additional efficiencies within HR and across the city. Partner with the Office of Equity and Opportunity to support and expand current workforce diversity, inclusion, and representation initiatives, including improved collection of City of Hartford employee EEO data. This concludes my formal presentation. However, we have 5 additional slides in our appendix that break down the Hartford residency and EEO for full-time employees as of March 31st, 2021, as well as Hartford residency and EEO data for new hires from April 1st, 2020 through March 31st, 2021. Although under the current law, it is illegal to require Hartford residency for any position covered under a collective bargaining agreement, which represents 92% of the city's present workforce, we were successful in hiring nearly 60% of Hartford residents between April 2020 and March 31st, 2021. I will now be happy to accept any of the questions that you may have.
Thank you, Marlene, for that excellent presentation. I'm sorry, can you guys see me? My video is going off. Now I'll open the floor to my council colleagues. Councilwoman Surgeon.
Thank you, Madam President. Marlene, good evening and congratulations. I remember the days. I am so proud of you.
Thank you.
Oh, yeah, Marlene, and we go way back from the 90s, 2000, and you hang in there with the city. And I am so proud that you are the epitome of one of the Hartford residents who started working with the city and have moved up within the ranks and were given the opportunity to continue to serve the city and utilize all your experience and your knowledge base in the 20 years you've been with the city. So thank you for hanging in there with us.
Thank you, Councilwoman.
You did great. So don't be nervous, okay? You're fine. You're okay. Got a couple of questions in your budget book. One of the things, you said that you had another slide, you had a couple more slides regarding the percentage of the diversity and so on and so forth. If you could send that to us, that'd be great. But looking at the budget book 18.3 and number of new hires in Hartford for Hartford residents, we do understand the state guidelines, that you can't make Hartford resident a part of the hiring process. But these numbers have gone down. Looking at 21, it says about if you started from 2018, where you had out of your new hirees, 136 were Hartford residents. You're down now to 30 new hirees. So we see that the number being decreased. Do you know what contribute to, you can't find the qualified people that are Hartford residents? What are the issues? I know you're acting and it's your short time there as the director. From your knowledge base, what are the issues preventing Hartford residents from being hired, for the job openings that we have?
Okay. So the numbers that you're looking at, Councilwoman, are fire numbers from 2018. It's the class of 2018 that you were looking at.
Yes, ma'am.
When they were hired. So, but in general, as far as hiring right now, if you look, I'm not sure if you see the appendices in the back of the slide presentation, but we have the total and the diversity and also the number of Hartford residents. So then I'm not sure about that particular question as far as the page right there, but I can get back to you on that because I don't want to give you any wrong answer.
I understand. It's just that when you look at the budget book, we saw the decrease, from in 2018, new IREs. Yes, I do have it in the slide presentation, and I'll do a little bit more, prove that a little bit more. It's just that looking at that page, in 2 or 3 years, now then, you're only down to about 30 persons being hired of Hartford residents. So that's what I was looking at. And also the number of employees who are Hartford residents. City's still kind of holding their own, and 39% you're projecting for 20, that was projected for 21, and you're projecting about 44% for 22.
Yes. And the goal, Councilwoman Surgeon, is always to try to engage for Hartford residency. And what we're trying to do, COVID did, not help as far as trying to get out. And what we are going to do going forward, and with the restrictions lifting, we're partnering with departments like GFCYR. We're going to go out. We're going to do job fairs. We're going to get into the community. We're going to have things here. So the goal of HR is to definitely do things and try to have more opportunities for Hartford residents as much as possible.
Understandable. We only have X amount of time in the day. I know you probably don't know this off the hand right now, but when was the last time the city has taken a look at all the job descriptions, and update the job descriptions? If you don't know, we can know. You can.
I definitely don't know I don't know when they looked at the job descriptions. However, I do know that in order for us to get the job descriptions updated, I'm sorry, I'm being okay. So I was just told we have them updated on a case-by-case basis. However, being here for a while, I do know that they're outdated, right? And they need to be more dated. So with the limited resource we have, we would need some funds allocated so we can hire an outside firm who specializes in that field. And also with that, we may have to do some negotiations with the labor unions as well.
Yeah. So could you get back with me and give us an idea of what it would cost, to update or rewrite and then negotiate with the unions? Because that could be a possibility, because these job descriptions were written, I think in the 60s. And we are now, in 2021, we have gone through a pandemic. I think just basically, work from home is a new thing now. So trying to bring the city human resources, as far as the job description are concerned, up to 21st century, that would be something I would like to know what the cost could possibly be.
Yes, I will definitely get back to you.
Yeah. And you said you guys are going to be doing about 2 new union negotiation that's going to be expiring. Is it 21 or 22? Let me see my notes here.
Well, we have Premier negotiations. Their contract expires June 30 of this year. So we're in active negotiations with 1716 Chapia and Hamir to date.
Oh, so 3 unions. You're in active negotiations now.
Yes.
Okay. And in your slide presentation, did it tell us how many members are in those unions? Looking at the end of your slide.
No, those are just the demographics for employees. However, I can get a breakdown to you of each member of the unions.
Yeah, the number of union members. That will be.
I can tell you Hamia has 186, but I'll get 1716 for you, and I'll get Chapia as well.
Okay. I think that is I think those answers my questions. Yes, I want to thank you so very much for your presentation, and I'm looking forward for seeing you as possibly maybe director next year when you come back to work presentation. So hang in there, okay?
Thank you, Councilwoman Surgeon. I appreciate it. Thank you for your support.
Thank you, Councilwoman Surgeon. And on that note, Marlene, it was very refreshing to hear your story through Councilwoman Surgeon. So congratulations to you, and I echo her sentiments. And to Mayor Bronin for giving you the opportunity to serve as interim. And like Councilwoman Surgeon said, hopefully you'll move into that director position.
Thank you, Council President.
Yes, we're here to support. Do any of my other council colleagues have any questions? Councilman Clark?
Thank you, Madam President. Through you, Marlene, it's good to see you. You and I don't go as far back as Councilwoman Surgeon, but it's been a while.
I'm older than you are, okay?
We go back a ways too. But thank you for your presentation. I just had some things I just wanted to ask for clarification. As far as the, so you mentioned regarding the fire exam, and there's also a police examination as well?
Yes.
What's the process that HR undertakes to get an exam ready? Is that an exam that the city administers itself through the HR department, or is it contracted through an outside vendor?
I'm going to let my principal analyst answer that question. That's in charge of, I have both analysts for fire and police here. So I'm going to let my police analyst answer that question right now.
Good afternoon, Majority Leader.
Good afternoon.
And good afternoon, everyone. With regards to the police examinations, we are contracted out through a examination vendor. We also do participate with the examination process throughout the whole process.
Okay, and so that's both for police and fire, am I correct?
That is correct. One same vendor, they create the examination, we proctor the exam.
All right, so one vendor for both departments.
That is correct.
Yeah, okay. And is that done on a case by case? So every time that there is an opening for applications for police and fire, so it's the same vendor contractors, or every time, let me back up. It's the same vendor always the one to work with the city, or is it a different vendor every time that there's an opening for police and fire?
At this time, it is the same vendor. Now, each time there's an examination process to maintain the integrity of the examination, the exam itself is changed, altered, or it's in similar format, but the examination process is still continued.
Then what do you mean by change or altered?
So that if an individual goes through one examination and unfortunately is taken out of the examination for any purpose, when they go to reapply, they're not seeing the same examination. So the process is to ensure the integrity of the examination is maintained by having a different sort of examination. And with regards to the test vendor, we do go through RFP every 3 years, so it can potentially change, but at this time it is the same vendor for both fire and police.
Okay. And another question that I have, because it's been brought up in years past, how culturally sensitive are these examinations? Like, is there any type of, what I'm trying to get at is could there be any type of cultural bias detected in this written examination?
There's always room for cultural bias. At this time, the test vendor is aware and ensures that they keep that in mind, unconscious biases. So they establish all procedures with the law and the current climate to ensure that these biases are not part of the examination process.
Do you, after the administering of the examination, do you all keep track as to how many people that are Hartford residents pass versus non-Hartford residents, and by ethnic and racial makeup?
Yes, we do. We do an adverse impact review to ensure that Hartford residents and minorities are both not impacted by any of these said statements. We make that a focus in HR. Okay,
it's good. I would like to request if the percentages results could be sent to myself and the rest of my council colleagues over the last, maybe say 3 years, since you said the vendor usually is retained for 3 years.
Will do.
Okay. Is there any follow-up to assist those that are particularly Hartford residents that are minorities as to assistance with trying to get them to pass the examination?
Absolutely. HPD specifically, as I am the lead HPD analyst, they have a recruitment team that focuses on supporting Hartford residents with practice examinations, practice oral examinations, support every Saturday with the physical agility in order to better benefit Hartford residents when it comes down to police recruitments.
Now, I'm glad that you mentioned about the physical agility because am I correct that the physical agility requirement is a post standard, so a state of Connecticut standard, not a city standard?
Yes, it is, sir.
Okay. And also too, regarding some of the components of, since we're talking about police, some of the components of the police process, the polygraph, is that part of the post standard? Is that a city standard?
That is also a post standard.
And also to the background checks?
Yes, sir.
Okay. And what is the, would you be able to tell us how each of those sections are rated? Which is the more heaviest that is rated over the others?
Sure. There's actually no ratings for the background. It's it just goes through the process. There's a criminal background check. There's the polygraph background check, physical, medical, psychological. So it's just a procedure that goes through the background that's all established by post, but not weighted in any way.
So the results could be more of a subjective an analyst as to when you were reviewing the candidate and their these procedures?
No, they're actually established by post. There's immediate disqualifiers and subjective disqualifiers, but both are established by post.
Would you be able to provide us, you don't have to do it now, but more so email us as to what are some of the immediate disqualifiers on each of those categories?
Will do.
Okay, thank you. And we all love the city of Hartford and would like to see more of our residents have opportunities to get to be hired by the city. And I think many of us want to see a lot of our residents not just have entry-level jobs, but also to the supervisor, mid-management, upper-level jobs. Do you all keep track as to, based from a Hartford resident standpoint, in those tiers where our residents are placed within city government?
Can you ask the question again, please?
Is there, so do you keep track as far as the entry level, mid-level, senior level, and director level? Do you keep track of where the Hartford residents are in those categories?
Majority Leader Clark, we don't track it currently. However, we can track it. So if you would like that, I can try our best. Like it's available, so I can get it to you.
I would love to see that, just to see where our residents rank in city government.
Okay, definitely.
All right. Thank you.
You're welcome, Majority Leader.
Marlene, I think I missed your analyst's name. What is his name?
Melvin Gonzalez.
Melvin Gonzalez, and he strictly deals with HPD?
That's one of his departments, yes, and he also is assists with labor relations.
Okay, thank you. Councilman Sanchez, you have the floor.
Oh, and all right.
Followed by Councilwoman Rossetti.
I just wanted to let Marlene know you're doing a phenomenal job. And I know you have been put in this position in an unforeseen time, but thank you for your hard work so far.
Thank you, Majority Leader Clark. I appreciate it, and I appreciate your continued support.
You're
and
welcome.
Then right into a budget, huh?
Right.
Councilman Sanchez.
Thank you, Council President. Through you, Council President. Hello, Marlene. How are you?
I'm well, sir. How are you?
All right. Congrats on your position. I would like to call your position acting director, and hopefully you'll fill that position in soon. I do have a question to follow up with Majority Leader with Melvin.
Okay.
And what is the name of the contractor that we have?
Morrison McDaniel.
Morrison McDaniel. Okay. So right now, the last RFP, they were awarded, and it's for a 3-year term, correct?
Yes,
Okay.
approximately. Mhm.
Okay, so who were the last two vendors that we had? Or were they the same people?
One second, I have my team getting that because I wasn't here, sir. So they're
No
getting that
problem.
answer for me.
So I'm going to continue with my next question for Melvis. He was explaining about, I believe, is the rotation when it comes to the exam. So is my understanding that, for example, the questionnaire. So let's say you have 1,000 questions, and out of the 1,000 questions, every time there's a written exam, it would entail 100 of those questions. So the next round, those questions will be changed for other questions. Is that what I'm understanding?
That is a possibility, yes.
That is a possibility.
Yes.
So can you be more precise on that?
Can you ask one more time?
Can you be more specific?
Yes, at times the order of the questions are changed. And when it comes down to the proximity of the examinations, it can be, the question itself can be a similar question, just asked in a different format.
Okay, and then the next exam that I'm questioning is the what you call that, the lie detector exam. All right, I know it's a different terminology for that. So is there anything in place for the candidates that are that pass the agility test? All right, is there anything in place to educate them on the process of that, and how to obviously we're not going to give them the answers in advance, but I think it's important for them to understand how that process works, because sometimes they, in the past, I had many conversations where they're afraid to answer the question because they feel that if they're truthful about someone, whether it's their family or someone they know, that's going to work against them. And that's important for me and for them to understand that that's not the case. So if they were asked a question, for example, do you know anyone that sells drugs? They would be concerned that if they say yes, that's going to work against them, where they should say, if they say no, if they say yes, it'll work against them, but in reality, it won't. They don't understand this. So do we have anything in place to educate them on this?
We in HR do not have a process in place with regard to the polygraph. That's all handled by the background division in HPD, separate and distinct from our HR process.
So can we create a plan for that? We don't have to depend on the police department to do this.
Yes, we would have to look into that matter because we're not the subject matter experts with the polygraph and the post. So we would absolutely consider and get back to you on it.
Okay, thank you. So Marlene, so my next question, and the reason why I rather call your position acting, right, is because now we have the situation with the interim positions. All right. Is my understanding from a few years ago, and I think it still exists, that we have several positions at a higher level where we have interim employees that were retired and filled these positions until they can find a permanent person for that position. But yet we still have several people who's been in that interim position for years after they retire. My understanding is a cap of 6 months. Then they leave, but yet they're called back. So when are we going to fill those interim positions to make it a permanent?
Councilman Sanchez, do you have specific interim positions you're referring to, or just in general the topic in totality?
In general, the topic, and what I was hoping is that you can get me that information.
I will. I'll get you that information as quickly as I can.
Okay, thank you. I'm done.
Before I pass it on to Councilwoman Rossetti, I have a quick question, and I don't know if I could address this question to your analysts regarding HPD. When I believe Councilman Sanchez referred to the polygraph test. Do you know of other police departments that have that same process as the Hartford Police Department when recruiting and going through the process? Since the results of a polygraph test are detected unreliable. I don't know if this question is an HR question or actually a question to the Hartford Police Department, but when I'm going through the recruiting process and going through a lie detector test within HPD in the city of Hartford, do you know if other municipalities go through the same process?
Thank you, Madam President, for the question. Just to be sure, I believe that would be a HPD question. However, I would be happy to ask on your behalf and get back the answer to you.
Okay, thank you.
You're welcome.
Councilwoman Rossetti.
Thank you, Council President. Marlene, first of all, I can't think of kudos to you stepping into a position such as this during a pandemic. So I want to thank you. I want to thank your staff. I know everyone's had a tough last year and a half. Some of my colleagues asked some of the things I was going to ask, but I am interested only because health has become such an important, even should have been important before, but with COVID, on page 18-5 of the budget book, you talk about under program services, health and wellness, encouraging a healthier workforce, which is so important. How do we actually do that? Is there and particularly going forward when things open up a bit, I think it might be important to figure out how we can do that. How are we going to do that within the city? And I also hope to see you here.
Right. Before I let my benefits administrator get on, there he is. Hey, Rich. I will say before Rich speaks that we are encouraging different programs that we have in training for stress management. We're working with EAP to ensure that all employees have that outlet when needed, at any time for not only them, but their families as well. Right. So we want to make sure that at any time they need any type of support that we offer that to them. And now I'll let Rich continue.
All right, thanks, Marlene.
Hello, Councilwoman. My name is Rich, and I'm the benefits administrator. And that's a very good question because we try to do our best to provide employees opportunities for their overall wellness, whether it's mental health or physical health. So we put together programs, and a lot of those programs Marlene had mentioned in her slide deck. And those programs are either cost neutral, or Cigna will sponsor some of these programs for us. But with a high deductible health plan that employees have, they have skin in the game to be healthier, and we want to give them the opportunity to have programs to do so, because the healthier they are, the less they spend. They don't have to pull out their HSA bank card. So we've been on a full court press during the time of the pandemic because we understood the disconnect between employees and the city and their own health and family during the time. So Marlene was really on top of us to make sure that we had EAP programs, that we had wellness programs, that we have a health coach through Cigna 2 times a week. So we have a multitude of programs that are ongoing at all times to engage employees here at the city of Hartford, both mentally and physically. So we've actually bumped up that program, those program offerings to a degree, but yet it's no cost to the city.
Thank you so much. And really, as you say, Rich and Marlene, how important is this, particularly during, this last year with stress and for employees and their families? So thank you very much.
You're welcome, Councilwoman Rossetti. Thank you for your question.
Councilman Gale, you're up.
Oh, thank you. Marlene, I don't have a question. I just have a comment. As I listened to your presentation and flipped my pages on the of the presentation, there was one thing that stuck out immediately, and I just want to highlight it and thank you for it. And that is the statement you put in there about how your department wants to explore employee recognition programs and more regularly recognize employees for the value of their contributions to the city. I think that's tremendously important, and I'm really thrilled that that you've taken, you've thought it important enough to put it into this presentation. And in any way that we at council can be helpful in doing that, please, please lean on us. I think that's a great idea. Thank you.
Thank you, Councilman Gale.
I'm glad that Rich is on here, because I have a question. There's a tremendous amount of employees that actually talk to us about the HR benefits, and I know that we have shifted from the PPO to the high deductible health plan, and many talk about how it's really not affordable to some employees, depending on how they rank in salary. How have the claims trends been regarding that? And will there be, can you forecast a time where we may go back to a PPO or have a health plan for the city employees that actually could be more financially feasible for them? Oh, Rich, you're muted.
Councilman, thanks. I appreciate that question. It's a question we struggle with every year because, as you know, healthcare never goes down. And once you sort of cross that bridge where you provide a high deductible health plan, it's difficult to go back and provide a PPO, which is really much more expensive. And regards to claims experience, a high deductible health plan allows employees to be better and wiser consumers of their healthcare dollars. Before they go to an emergency room, they want to go to a primary care physician or an urgent care facility. So that helps to decrease the cost to the city overall. It's not popular, but the city employees, have embraced it. We, like all the other cities in the state of Connecticut, have high deductible health plans. Do I see us going to a PPO? I mean, I don't know. I don't have a crystal ball. It doesn't look promising. But moving forward, I hope that the trend does decrease eventually. I mean, our trend was a little bit less this year because of the COVID, so people weren't accessing their healthcare providers or their specialists. So there was a little bit of a decrease. But moving forward, our trend is trending as a whole to 7%. So as a matter of fact, our trend is a little bit higher than 7. It's about 7.9% for this coming fiscal year. Unfortunately, it's not the medical side that was really the problem. It was the pharmacy side. And on the pharmacy side, the issue of specialty drugs is really a challenge that we have to, contend with. More and more pharmaceutical companies are coming out with orphan drug status drugs that are high cost specialty drugs. And our budget last year was about 42% of our gross budget was on specialty drugs. Now it's 46%. 46% of the entire spend on drugs, which is projected to be about 6.6 million, is on specialty drugs. And believe it or not, you're talking about 2% of the population that access those specialty drugs, or about 1.5% of the drugs that are dispensed are specialty drugs. So it's that's the challenge I think we're facing, not only on the medical side, but on the pharmacy side, is the increase in the pharmaceutical creations of drugs for very specific issues for very specific people. And if you get a lightning strike, and I'll give you an example, Councilman, there's a new drug that was just passed by the FDA for obesity. Now, there are different therapeutics for obesity. This one has to be just genetic, and there's only maybe 158 known incidents of this genetic issue with some people, and it's $450,000 a year. So if we get a lightning strike for that individual, we're in trouble. And we're in trouble for cancer, rheumatoid arthritis, psoriasis. Enbrel, Humira, all these drugs are very expensive until they come off patent and get into a generic situation. We're just grappling with how to manage those high cost drugs. So it's not only the medical side that we have to pay attention to, it's the pharmacy side, which is another problem.
Thank you, Rich, for that explanation. Given the fact that these specialty drugs are increasing, is there anything that the HR is working on regarding health and wellness to help individuals manage their health more efficiently, so that their reliance on these drugs can lessen, or their codependency, so that there's other mechanisms such as natural remedies or more natural treating the total person?
Yeah, I think one of the high cost claimants that we have are that are comorbid with comorbidities, and those are people with diabetes. And diabetes on our drug spend, 10% of our gross cost is diabetes drugs. And what we do is we take those drugs and we move them and we shift them away from the deductible, so they only pay the cost share of the copay for those drugs, to adhere to make sure that they take their diabetes drugs. So we do have programs that focus on diabetes, and to make sure that if they take their proper exams on a monthly basis, that they get credited $50 a month. So we'll send them a check, not only for them, their family members. So programs like that are low-hanging fruit that don't cost a lot, we tend to focus on, because diabetes is really a key driver of the cost of not only drugs, but also on the medical side. So we want to keep these individuals out of the hospital. We want them to adhere to the diabetic drug regimen. So that's low-hanging fruit. But as far as like naturopathic, we don't have a program that specifically deals or provides those types of drugs. We really, what we provide is the FDA approved drugs. If something's not FDA approved, such as like compound drugs, when there was a big scare at the state of Connecticut where they were spending $23 million a year on compound drugs, which is just a number of different over-the-counter drugs put together, and they sell them, for God knows how much cost. Those types of drugs were not FDA approved, and we put a cancellation to it. So we didn't have much of expense to that. So we don't really focus on, we just focus on the FDA type drugs.
Okay, that's interesting. We'd love to see if there was some type of way that the city can create an initiative for more health and wellness or holistic natural remedy approaches for that, because I know I'm concerned really about people's mental health with still operating in COVID, and then as far as behavioral health, going to their behavioral providers, and what the clinician will actually put in as far as a prescription for that city employee, which could ultimately drive up that cost.
You're right, and mental health, Councilman, has been a big issue, and we've really, like, Marlene has been on top of us to make sure that EAP, we send out information on EAP, we talk to people at EAP. We have a health coach here that Cigna gives us access to 2 days or 3 days out of the week. She focuses on mental health as well as nutrition and everything else that goes along with that, to complete the whole body wellness type situation. But we are very well aware of the issue of mental health in the workplace. Listen, nobody just leaves the baggage at home. Everybody brings it with them at work. And, we see that with, people trying to take time off, either FMLA or otherwise, on mental health issues. And hopefully we'll focus a little bit more on that, maybe create some kind of programs to assist people in addition to EAP on that that specific subject.
Would love, would love to assist Marlene and yourself on some of these initiatives. I'm a proponent now for natural remedies. Some of my colleagues know I'm a natural juicer. Shirley shaking her head.
Look at that skin. Your skin's flawless.
That's how this.
Got a tan. He's got a tan. Okay.
So things like that I know that I have implemented in my own personal health and wellness lifestyle that has made my life a little bit more better and everything. And so I think that maybe once we can get through some of these logistical issues with, through the CDC guidelines, some type of marketing or programs we can do for people to, touch, eat, feel these things. So, but I don't want to monopolize everybody else's time because I could go on and on about this. So I don't think that anybody else has any questions. Councilwoman Surgeon, yes.
I just wanted was to ask the HR director, are there any plans or any consideration or any thinking now that we have gone through the pandemic and the way our workplace has changed? And I know you said you have 2 or 3 union contracts coming up. Any thought are they going that you can offer employees, some days some work from home, some days in the office? I'm not sure if the administration have thought about that, because I do know that the pandemic has changed the way we do business. We were given or equipped with telephones and laptop and internet, so actually being in a physical office, is that something where the government is going to catch up with the private sector now?
Great question, Councilwoman Surgeon. We are right now, the administration is currently working on a program that, it's going to be in the future, however, of permanent, not work from home, but a work from home policy. Yes. Whereas at some time, maybe at some point, right? Because through the pandemic, we've all learned, like you said, that, we were able to successfully operate at home in some departments, right? So the administration, I know, is going to work on a policy in the future, and I support that as well. And I can get more information once I get it. I can give it to you. But we're definitely, with this pandemic, we were able to see and actually, go through it as a first time, like, hey, like you said, we can work from home. We do have computers, we have the technology, and we were successful in doing so. So those are things that we're going to explore. And as we explore them, I'll be sure to get the information to you and the rest of City Council.
Okay. And just one last question. You yourself went through a, moving up within the ranks. Does the Human Resources offer any counseling advice, for young people coming into the city as their first-time job and working with them, providing a career path in the city? So you, as I said, you as an example, that'd be something that'd be great to see instituted, for all city department.
Yes, of course. Thank you for the question again, Councilwoman. It is something that I would love to see as a person that, like you said, moved up myself. It is something that I'm passionate about, something that my team and I have already discussed, and we're going to work on ways to continue to train. There's a lot of people, and, no matter what union or what rank you're at, that wants to excel, and I'm all about acceleration. And so we're working on programs, we're going to work on trainings. Back in the day when I was here, we had a 10-week program that was administered for supervisors training, through HR. Of course, we had more staff then and everything. However, we're still working with the people here, and we're trying to implement trainings, and we're going to make sure that we implement trainings for future acceleration for everyone and give everyone the opportunity to excel.
That's great. And one thing I would just one last thing, but it's not a question, a statement. One last statement, at least have a success plan in each department individual. One of the things I've learned with the pandemic is that, nobody's guaranteed to be here. And historical knowledge and how we do business, in the city is lost a lot of times when people move on to bigger or better jobs. And so success plan and, policies and procedures, I would love to see, make sure Human Resources are, making sure all the departments, for each different job, each different duty or different position, that information is written somewhere.
Yes, thank you, Councilwoman Surgeon. I agree.
Okay, well, again, thank you so very much, and thank your staff for spending their evening with us. I appreciate it. I'm finished now, Majority Leader Clark.
Thank you, Councilwoman. Just one quick question. I just wanted to follow back up with Councilman Sanchez was, I think he was trying to ask the question. per our municipal code, a person who is in an acting capacity is only for 6 months, correct?
Yes.
Okay. And then if that person, if that time lapses, does that person automatically leave, or how does that process work?
It depends on the position, but to my knowledge, right now, you know, the city always wants to hire permanent, right? And so unfortunate in some situations, they have to ask people longer than anticipated, right? Due to lack of eligibles or qualified candidates or anything, or extraordinary circumstance qualifications. But after 6 months, the person continues. However, the city leadership and HR keeps an eye on it, and we can constantly try to minimize someone acting in a long-term capacity.
Okay, thank you for that. Could I just put in a request at more of that senior level? If that is taking place, it'll be good if there's some type of FYI, some memo sent to the council just to let us know, so that, because we have residents who call us, and sometimes we know about things, sometimes we don't know about things, and so it'd just be great if the council just is kept in a loop about that.
Okay, thank you, majority.
All right. No other questions from anybody else, including myself. You all were great. Thank you very much for your presentation and answering our questions. And we look forward to continuing to work with you and the rest of your staff. And you have a wonderful evening.
Thank you so much for the city council and everyone. And I would just like to say thank you so much again to my team. You know, the benefits team and the HR team has worked tirelessly. Like I said, you know, before, I would not be able to sit here before you all without their support and their hard work and dedication. So to my team that's listening, to my team that's with me here, I just want to say kudos. Thank you so much for everything. And again, there's no I in team, so we're all one, and we will continue to work hard to serve the city of Hartford and its residents.
Great. Thank you.
Thank you, Marlene.
Thank you.
Thank you, Rich. Thank you, everybody else.
Good night, everyone.
Good night. All right, we are moving on, and we are at time check at 7:45, and we are on our last department for the evening. And we have none other than the DJ herself, and Ms. Kim Oliver, who's the director of the Department of Families, Children, Youth, and Recreation, and she is joined by some members of her team, Christina Baldwin and Troy Stewart. And so, Kim, we are in your hand.
Hello, thank you so much, Majority Leader Clark, and hello to all of council and also our public. Yes, joining with me is Mr. Troy Stewart, Assistant Director for Recreation, Mrs. Christina Baldwin, Assistant Director for Youth Services, and also with us is Mrs. Shailene Lopez, Administrative Operations Manager for Early Learning. She's on with us as well. I'm going to go ahead and hit the share here, hopefully, that you guys can see my screen. It seems like it's, there we go. So hopefully you are seeing the screen, and I'm going to go ahead and jump right into our presentation, as I know it is 7:47, and I'm sure you guys are ready to move on. So our department, we basically do what the name says. We focus on ensuring that Hartford families, all Hartford families, are going to have access to well-being and also to success. We do it primarily through 4 different ways: workforce development, youth development, early childhood education, and also recreation, and also other related programs that may be family or child-centric in nature. And really what's critical and most critical is how is it that we get and keep our young people on positive and productive paths. My department is made up primarily of 3 different divisions: early learning, youth services, and recreation and family services. And our general budget for FY22 recommended is 15 general fund positions, as well as 34 grant positions. I want to acknowledge that 76% of our population are Hartford residents, 41% are women, 54% are men. The other are other or decide not to respond. In terms of race and ethnicity, we have of our population, 43% is Latinx, 26% is Black African American, 11% is Caucasian, 1% Asian, 1% American Indian, and the rest are other races. Our department has gone through a lot, similar to others in this past year. And this department is the community, and we serve the community. And it was a really tough year, but we had some amazing stars and leaders in our department, and I'm very proud of them. And I want to acknowledge that they did a lot of hard work and were on the front lines during COVID when we didn't know all the answers that we know today. They were supporting other departments and also Hartford Public Schools as part of serving the first million meals. They were in the isolation centers. They were in our parks. They were in our classrooms with children, supporting essential workers. So my thank you to them, and also to the leaders who are with me this evening. If it wasn't for them, we wouldn't have been as successful as we've been able to be, and also being able to get through some really tough times still with a smile on our face and being able to support our community. So some highlights from this year. In early learning, almost 1,500 toddlers and preschool slots in our center-based classrooms, 182 coaching sessions. And this is what our family child care providers, which we're really proud of, and part of our Hartford Talks program. You might remember Hartford Talks is supported by Bloomberg Philanthropies What Works Cities initiative, and that we are one of only 5 cities in the entire country that's getting that support. And in fact, up against cities like Detroit and Virginia Beach, et cetera, we have been outpacing them in terms of our success. So my great thanks to the team with that, and also to our partner providers. 73 family child care providers in our Hartford network. This is a network that we just formalized in September, October timeframe. So to have already 73 providers and growing, because we had some others who hadn't finished their paperwork yet, who really continue to work with us, where we're able to provide them holistic and comprehensive services and supports, especially during a time where it is our family child care providers in particular who stayed strong and stayed open throughout the pandemic, you know, and many times putting themselves at risk and their families, because many of them are doing this right out of their homes. So our thanks to them. 36 of our center-based classrooms continued again through Hartford Talks. Again, this is during the pandemic. And we secured $12 million from the Connecticut Office of Early Childhood for our school readiness program. And we contract with 15 different providers across the city to support those 1,500 children. In youth services, we have 1,158 young people who are part of Youth Service Corps since the beginning. And this year we have 160 of them who are actually active in the program. Youth Service Corps, as you may remember, was something that was really important for the mayor to put in place year one, and we were able to do that in the summer of 2016. And already $4.5 million that our young people have earned while serving our community. So it's been a transformative program for so many, and we're really proud of that program. 808 young people who participated in summer youth employment last year. And again, this is during the pandemic, when we did see families who were really concerned about their children being, you know, out in public. We did have some employers who were able to ensure that health and safety of our young people, and were able to still have on-site work-based learning opportunities and internships. But we also saw a lot of innovation and modifications to the program to offer opportunities for virtual programming. And we did this in a place where we were also able to wrap around all of that a lot of mental health and wellness supports for our young people. We have 377 young people who are part of our Youth Justice Initiative. And our Youth Justice Initiative is where we give out more than $500,000 each year, and it's to encompass First Peace Builders Program, Artist Collective, Our Piece of the Pie, and Why MCA. These programs have proven to be so critical. It's been a really tough time, as we all know, and they really provide important services going from the continuum of early prevention as it relates to youth justice all the way up to crisis intervention and reentry. We have 181 disconnected justice involved and at-risk youth in North Hartford, as well as 119 disconnected high school seniors that we're supporting right now with outreach services. These are young people who are already either on the edge or already pushed over, unfortunately, in terms of being disconnected from especially education. And so our goal is really to support them with services, and we're being able to do that with the support of 2 federal grants, one from the U.S. Department of Education and another from the U.S. Department of Justice. And we do that in partnership with HPD as well as the North Hartford Promise Zone team. 57 of our young people as part of Juvenile Review Board. Juvenile Review Board, of course, is how we are able to provide a diversion opportunity for our young people who are arrested. And what really also makes this important is that it's about a restorative approach and a balanced approach to make sure that a young person understands what they did was wrong and also be able to restore that with community. And we do that with a contract that we give to the Village for Families and Children and with support from the state of Connecticut. 42 young people served as part of our rapid response program. That's part of our youth violence prevention and intervention work group. This is something we started back in February 2019 when we saw, unfortunately, this increased rise in youth violence. And what we've been able to do is for young people who have been involved in shootings and stabbings to really make sure that we outreach to them, their families, and our goal is to prevent violence, to reduce violence, and also especially to reduce retaliation, because as many of you know, it becomes unfortunately this cycle of victimization to actually being a perpetrator. So trying to assist our young people with that. And as you can see, since that time in February 2019, we've actually served 142 individuals. When we move on to recreation, more than 37,000 visits still to our Kevin L. Bell Playground, the Splash Pad program. In the past, we didn't always say Splash Pad. One of the things we had to do this year was modify our program and really move away from our playgrounds for health and safety reasons. And really the Splash Pad program actually expanded the program in terms of its hours, going from 12 noon to 6 p.m. Monday through Friday at 11 sites across the city, and it was very successful. 3,500 residents served by our park ambassadors. And so these were our recreation staff that were going to our 7 major parks in the city, providing information to people, making sure they had hand sanitizer, face masks, etc., so that they were able to go out and enjoy our parks in a really healthy and safe way. We were initially concerned and how that would be embraced by community, but fully we were embraced. And part of that is because, again, we are community ourselves. And so it was really great to see how supportive we were able to be of each other in terms of our recreation staff to our community and vice versa. We have more than 1,000 of families and individuals on our MyRec system. Many of you know that this is something we've been working towards and working on for now a few years. This is an online platform that really acts as a centralized hub for recreation activities, and also gives an opportunity for reservation of programs and registration with programs, but also reservation in terms of facilities. And this also includes our facilities and fields through Department of Public Works, in which we partner with. This year, we received admin rights, and we're so proud of the site. And so we invite anyone who's not been there yet to either go through our department page and hit on recreation, or you can do hartfordct.myrec, that's MYREC.com, and it'll bring you to the website and you see all the great offerings we have there. And then we have over 1,000 of our children right now who are being served in a special program in partnership with Active City, where it's actually a collaborative of multiple sports programs citywide who are working with us to expand access. So this is about getting our young people and our children who may not have been in programs, perhaps they didn't have it in terms of affordability. This is free programming to our young people, again, knowing how important it is for socialization and just all the social, emotional skill building, but also in terms of leadership, et cetera, and exposure to sports, which we know, again, can be so important to our kids. So as we look at our strategic initiatives and our different divisions, when we look at early learning, really it's about early literacy and child development. And how is it that we are going to be able to partner with our families, support them, and really accelerate that work? We know that if we get it right in the beginning of life, that will continue and the probability of success is much higher. Unfortunately, the opposite is true as well, that many times when we look at some of the issues that our young people are facing and our families are facing, it can track back to issues that happened when they were young children, and it manifests, right, and calcifies as time goes on. And youth services, we do a lot of work here in terms of capacity building, collaboration. How is it that we're fully, there's a reminder for Kim. My apologies, hold on. Okay, going back to youth services, how is it that we are making sure we're truly addressing unmet needs of our young people? And how is it that we know that we're being effective, right, and actually moving the needle so that we can be supportive of our families and our partners, and especially our children, right? So that they will be successful and be connected to community. And finally, in terms of recreation and family services, we want to make sure that people have access to recreation. Recreation is your time off, right? Away from when you're working or you're in school. And how do you have fun and enjoy your life and do it with your friends and do it with your families? And again, access is so important as we talk about recreation. And we have a special focus on our adolescents and our girls, ensuring that they too feel included and part of our world of recreation. So when we look at our department in total, one of the reasons I wanted to include this slide is because we really have all these different initiatives I spoke about and all these different numbers. But when you look across our department, what is it that we are doing? It's all about increasing engagement and also increasing learning. And if you look at this slide, what I've basically pulled out is showing how we're doing that in our different divisions. So for example, increasing engagement in young children and early learning is about increasing attendance in preschool. And so that's making sure that families know that they have access to preschool and that it's affordable and that they're actually going and treating it as education and in terms of which it is, right? Another example of this is in terms of increasing learning and recreation. We do so much recreation that's around social, emotional, and leadership skill building. And it's really critical that we continue to really emphasize that ability for us to do the playful learning and growing that you can do in recreation. So when we compare our budget year over year, as you see in our general fund, basically we're looking at a flat comparison with only a slight increase due to salary increases. Grants, you are seeing some contraction there, and mostly it is because we do have some grants that are sunsetting. And I also acknowledge here that we did see some impacts of COVID. So for an example, utilization, unfortunately, in preschool, a lot of families lost their jobs and could not afford preschool, or people were at home because they weren't working, and the decision was that they didn't need to access preschool. And so as a result, we did see some slight decreases there. But overall, what that means is that we are still, moving from a $17 million department to about $16.6 million department. So there is an increase year over year of a negative 3.6%. So when we look at our budget in total, this is how it looks. I know this is also in your budget book, but just to highlight, youth services has our largest chunk in terms of our general funds with almost $1.8 million. And I just want to highlight here, more than 1.5 of that million is the direct services between our youth employment, also our youth justice work. Similar recreation, over $1.3 million. Again, similarly, we're talking direct services. Most of our funding is actually for our staff that works directly with our children in our community. And then early learning is in at 8%, is a much smaller piece because we have mostly grants, as you can see, that makes up our early learning chunk. And then finally, administration at less than 10% at about 9%. And with that, that is my presentation. I'll go ahead and take off the sharing. I'll stop share and I will turn it back over to you. Thank you.
Thank you, Kim, for your presentation. Very, very thorough. Thank you. And so I open it up to my colleagues if they have any questions for Ms. Oliver. Councilwoman Rossetti.
Thank you, Majority Leader Clark. Thank you, Director Oliver, and thank you to all your staff. I know it's been an amazing year. Let's call it amazing for the sake of any other words that we could use, not on public access. You know, my big concern, because we weren't able to do swimming last year, how are we going to safely open the pools this year? And what's going to be the kind of, how are we going to do that?
Yeah, there's been some great work around that, and I'm going to let Troy jump in here in just a moment. But I want to acknowledge, first of all, we're very fortunate because with Troy's leadership and others, we have a lot of partners across the country, and we're able to work with them in addition to just within our state. So there's a special system we're going to be utilizing this year to keep everyone safe and have our pools open so people can have fun. And there will be some limitations on that. And one of the things I say is it's going to be like going to a restaurant. Guess what? If you make a reservation, you're guaranteed a table. If you don't, you may have to wait for a little bit. So with that, Troy, I invite you to add to our plan for aquatics.
Well, thank you very much. Hello, everyone. Good evening. Basically, we're going to do a variety of different things so that we can make it easy for our community. We're going to make sure that we want to make sure that they have to register to come to the pool at certain hours, as well as we're going to make sure we have individuals out at the pool to help them register at the same time. We're going to have a certain number of people who we can bring into the pool itself, and we'll be modifying it as time goes on. The thing that's real important to us is that we have to look at the safety and also go by the guidelines that are presented to us from the American Red Cross and some other folks, so that we're not going in any violations. So as we move on, things keep on changing, and we're going to change as they go on. So that's what where we are at this present time. But we're looking forward to opening up our pools starting in June. One of our pools starting in June, and then the rest of them coming back, all of them come back on in July. So we're very excited, and so we're going to be moving forward on that.
Thank you, Troy.
Thank you, Councilwoman. Council President.
Hi, Kim, thank you for that presentation. Before you presented, I did ask Director Leani about the Arroyo Center. So the Arroyo Center is considered, is it a community center, a rec center? It has a pool.
Yes.
And so last year they were going to close down the testing, but then they extended it, and now they're doing vaccinations there. And we've had a lot of calls from the community wanting their rec center back. And so my question is, how many rec centers in the city of Hartford have the same services as the Arroyo Center when it comes to vaccination and testing?
Oh, wow. Okay. Well, we have our two big centers that have our pools. So we have Parker Memorial that's also doing vaccination in partnership with Trinity Healthcare. And also you mentioned Arroyo, that's in partnership with CVS. Our other two recreation centers, which are smaller and so not the same type of recreation centers, Willie Ware and Metzner. Metzner is under renovation, is going to be reopening on May 22nd. I invite everyone here to the grand reopening. That's a Saturday from 12 to 2. And Willie Ware is available and open right now. So one of the things that we want to make clear is that obviously it's, when you look at the building in Arroyo, it's a very special building, and also where it's located in the city in terms of being next to the highway and making it easy for people to get to and from off the bus line, et cetera. What we've actually been doing is working in partnership with Health and Human Services, the mayor's office, and others in terms of working on ideas around different traffic flows, so that we could get people like access to the pools, et cetera, because we know that our folks have been really patient, and we consider our recreation centers to be our community centers, and it's their centers, right? And it's something that I know that Troy and his team have been really pushing us and saying we got to get innovative and get back in our centers. Now, the cool thing is as we're going into the warmer part of the year, recreation is about going outdoors. And we have an absolutely beautiful park in which Arroyo sits, in the same for Parker, so that we are able to do services outside as well as take advantage of our pools. And so we put that in place and have a plan for that. But we acknowledge that it's a balancing piece there. And the last thing I'll say is a reminder to folks, national recreation has always had a role that is played as it related to public health and health equity. And so supporting public health is critical. And we don't want it ever to be a situation where you have to choose between being tested or vaccinated versus, having fun and a good time. So the good news is that everyone is on board with us figuring out how to make sure we can get folks back into that building and do it in a safe way for everyone involved.
And thank you for that answer. And I do understand, I'm a stickler, right, for health versus recreation. But the matter of the fact is, I can't believe, I can't remember if Director Arroyo said that they have vaccinated 5,000 or 9,000 Hartford residents. And I'm going to have to get back to her on that figure. And I'm also going to send her an email. I'd like to know how many Hartford residents are coming to the Arroyo Center, because I know for a fact that a lot of people from outside towns are coming there to get rapid tested and vaccinations. And this is a center that the community uses a lot. The kids go there, the elderly go there for Zumba. So I'll be forwarding an email. I am in total support of that going back to what it was. Because right now I believe that we have other locations that people can get vaccinated and tested. So thank you. And Troy, thank you for everything that you do. It's so nice to see you on the screen.
Thank you, Council President. Anybody else? Anybody else?
Yes. I know you don't want me to talk. I know. All right, guys. I know it's going to be a long night. Ms. Oliver, let me apologize to my my counterparts because everybody wants to wrap up and they know I'm going to probably ask a lot of questions. So I'm going to be really nice tonight and not ask a lot of questions. And if I don't get through all my questions, I'll put it in writing. So please bear with us. I know it's been a long night. It's been 4 nights we've been at this. So thank you very much to you, and thank you very much to your staff. It's been a long year, and I really want to commend you and your staff that you were able to transition from recreation and everything else and try to help out when we had the pandemic, and so serving meals and helping out. So that was great for your staff and your guys to transition to do this. So as we now transition and more people are getting their vaccination, and we now want to go outside, and our youth are, clamoring to do something for being locked up for the past year and school and everything else. A couple of things I would like to speak with you on, and that is in your presentation, you talked about the different partnership and service providers you work with. could we get a list of those and the programs they're offering to our youth in the city?
Yes, definitely. I will do a full list for everyone.
Yeah, because we want to know what kind of programs and who are the providers more than anything else. One of the things you talked about your family service program. Could you elaborate a little bit more? I'm trying to connect the recreation, the family service parts together.
Okay, so when we say recreation and family services,
yes.
Okay, so again, Troy, get ready to take the mute button off. Our approach to recreation is the whole family approach, right? So even though we're here, we have a target as I mentioned earlier in terms of our adolescents as well as our girls, and really doing skill building and swimming lessons for like everyone. We know that the best way to support our kids is to support our families. And so every program that we do have family components. And so we think about how is it that we're supporting the parents who are coming to, whether it's for basketball programs, our traveling baseball leagues, whether it's swimming lessons, et cetera. So, and Troy and his team in the past have done a great work in terms of parent engagement and support and education and learning. And so with that, Troy, I'll turn it to you.
Okay, thank you. The main thing is that we're trying to reach out with all levels. When it comes down to a child coming, we'll use the example of basketball. If they come to one of our basketball leagues, we make sure that we have some enrichment programs that go on for the parents itself on some of the things that they would like to work on or like to know about raising a child or whatever the subject matter may be. We try to put those components into the basketball program. So while they're waiting for their child during practice or waiting for the child during the game, they can be doing something else that can enrich in what they need to learn, something about life or how to raise a child. So that's how we try to mix the parents and child together. And then we do a lot of stuff together. We try to do a component where we have the parents come together with the child and do some competition with them so that we can have some fun and games and laughter. And then we'll have a guest speaker talk to them about whatever the subject matter, it may be about bullying or whatever it may be, the subject matter of that month, and then have a meal with them and sit down, a family style meal. So we try to come up with different concepts to make sure that the family can do something together while they're here in the building, as well as making sure that if there's some other things that, like, I'm glad that we have the Promise Zone and some other areas that we have inside our building and Catholic Charities and stuff that helps us out too, dealing with rent rebate, dealing with how to deal with certain problems that we may not know about, but we try to help them out with. So there's a lot of variables, but at this time, so I can't say right exactly, okay. But that's how we put it together.
So are we going to be able to have our aerobic classes back at Park Memorial or even the pool exercise? Are those going to be able to be open back up again?
We are doing virtual programming. We do have Zumba and aerobics going on at different time periods. So all you have to do is look up on MyRec. We do have those programs happening. Yes, we are going to go back to doing in the pools as well. We have during the pandemic, we did do a pilot where we had the pools open on reservations, the indoor pools, I should say, on reservations. And we did have certain classes going on inside the pools, but we made a decision in December to stop it. So the thing about it is that, yes, we are moving forward on that.
Thank you, Mr. Stewart. Ms. Oliver, I know over the pandemic, one of our couple of issues we had in the city is childcare.
Yes.
Parents are getting ready to go back to work now and they're looking for childcare. How is your department doing? Do we have enough childcare services? Probably never enough childcare service, but how do you think we're doing and what can we do, to get our parents back, in the workforce and being able to provide a qualified protective childcare service for them?
So critical. Thank you for the question, Councilwoman. When we look at childcare and early learning, we look at it holistically. And so I'll invite at one point Mrs. Lopez to join me in this response, especially around our family childcare providers. But when the pandemic hit and we had such an economic hit and so many people lost their jobs, we immediately saw our utilization of center-based, especially programs, just decrease tremendously. And until this day, all of the cities, the larger cities for the state, and it's a issue that's nationwide, we're looking at utilization of only about 60% as families are beginning to come back. Although we have to say families are beginning to come back and come back strong as people begin to go to work. When we talk about childcare, the three words that are so critically important is access, affordability, and quality. And we believe that is our job to make sure that our residents have all three of those, right? Not just one, but all three of those. And so the wonderful thing about the school readiness program is that if you're not qualified for Head Start, and your child is not in the magnet school program, you do have a high quality, affordable program that's based on your income. And that's where we have those almost 1,300 slots across the city. I will tell you, more and more parents need to know about that program. I have had many conversations once the child has aged out to hear about their child was not in preschool because they didn't realize that that was an option. But one of the things I did want to highlight, and one of the reasons I wanted to invite my colleague, Mrs. Lopez, to speak to our family childcare providers is because they were the ones who kept the doors open throughout the pandemic. I mentioned earlier that we have a network where we provide robust services to more than 70 of these providers. But when we were just, I'm very fortunate. I'm very lucky between Ms. Lopez and I have another employee, Mrs. Cartagena, who just were fabulous in terms of off the side of their desks, keeping in touch with these providers. And when it was, we were doing like 35 providers, they were serving almost 300 children. And my department was in touch with them. Also making sure when we spoke to families that we were making those connections. Families can call us at any time. Our number is 860-757-9595, or you can email us, etc. But our job is to make those connections happen and to support our providers and build that capacity. And with that, Mrs. Lopez, I didn't know if there was anything you wanted to add.
Before I hear from Mrs. Lopez, is there anything, one of the things you will, I don't think the administration does, we have 9 council members who are very, very active in their respective neighborhood that they live in. And if you want to, use us or provide, we have our websites, some council members do Zoom meetings, so trying to get that information about those 1,300 or 13,000 slots, please, share with us. So we can also share with their constituents, because as you said, the quality and the cost of childcare, it's very, it's hard, with this pandemic. So if you share that with us, we'll love to help you get that information out to the community.
Thank you for that. I would love that. Sometimes people call our department, they think we're DCF. So we're calling us on the run. But if you have a family issue, we want people to outreach to us. And one of the reasons that we have that main phone line is for some people, they feel more comfortable having that as a way to connect versus an email or going through the website. We have updated our website with some of that information, but it's, I can't tell you how many times we've had one-on-one conversations and continue to have to this day. Unfortunately, a lot of our families did lose their jobs through this process. So in addition to that, we were connecting families to food programs. We brought food bags out ourselves in partnership with doing extra programs above and beyond what we were working with Hartford Public Schools and Food Share with. So there was a lot of work done to support folks. And like I said, I agree with you. Not enough people know, and we will definitely take you up on that, because we're trying to do a better job of having the information centralized and easy to access, so that if you are speaking to one of our residents, that you're like, hey, you have this issue, here's the phone phone number, here's where you can go, et cetera, et cetera. And like I said, I'm very fortunate. I work with content experts who have been doing this stuff for like 30 years. They know their stuff. And when it comes to childcare, really when it comes to all of our work, we're taking care of people's children is so, so important. And you want qualified adults who are doing that. And we know how to make sure that we can get someone to a reputable provider. So I was just inviting Shailene to speak a little bit more.
No, please, let me hear. I would love to hear what she has to say.
So Shailene, this is the first time. So I just thought Shailene just speak just a little bit, maybe about a minute or so about our Family Child Care Network or anything else that you think may be relevant.
Hi, everyone. Thank you, Kim. In regards to our Family Child Care Network, like Kim stated, we started back in September, Ana Cartagena. We started off with, I would say, 57 providers. Right now, to date, we have 78 licensed daycare providers who serve over 400 kids in the Hartford area, and they're located strategically throughout Hartford. So they are small businesses within different area codes of Hartford, but also educators who really do not have the same opportunities as center-based. So one of the focuses is making sure that they are provided the same amount of opportunities as center-based, as far as training, funding, opportunity to grants. Anna has been able to train and work with WBDC to make sure providers are receiving grant information, along with training to make sure that their centers are also qualified. She's also been working with getting them nationally accredited. So right now, 45% of our providers are nationally accredited. And they also are being prepared to advance in their career. We have 9 providers right now who are going for their bachelor's degree with San Juan Center. We have 2 that are going to be starting in the fall. But our focus is training, increasing capacity, and making sure that they can sustain their businesses while offering family engagement. So our providers within our Family Child Care network is really focusing on those areas to see how they can support, but also sustain their business within the areas that they're serving.
Wow, thank you. And this is great to hear because these are women businesses.
These are women businesses.
Sorry, I behaved myself.
And also small businesses that are kind of, you know, the forgotten small business. The pandemic really brought light and shed light to the work that they do. You know, like Kim said, Anna's been working, you know, really, really hard with this opportunity, and just seeing how we can reshape how we provide services in childcare. That's one aspect, but also the childcare centers that the city of Hartford currently is operating. We have 3 childcare centers, like Kim said. One is reopening on May 22nd, which is going to be huge for the Metzner area. I think it's going to be great that we're going to be having 4 classrooms renewed, renovated, and you know, it's going to have impact on the community that we're serving in that area. So there's a lot of changes going on when it comes to early child care, but we really just want to see the impact that we're having with parent engagement. That's really our focus right now.
Thank you so very much. That is a wealth of information you're sharing with the council members and our viewers. Oh, it's a joy to hear.
Yeah, and yep, and I'm sorry to interrupt, but we also want to focus on how we can serve our own here at the city of Hartford. Troy has been working on that. When we say our own, we're talking about our own city of Hartford employees to see how we can access childcare opportunities for our own folks that we service. So, you know, there's been a lot of works during this COVID year of how we can have impact and what does that mean and what are these outcomes going to be and how can we measure them. So that's primarily our focus here in the early childhood.
Great, thank you. Kim, you should be awfully proud of your staff. That is wonderful. It is fantastic to hear. And I am being summoned that if I have any more questions, I need to put it in writing, even as I do have a couple more questions, but I will put my question in writing. Director Oliver, thank you. It was a joy to get this opportunity to actually talk with you and your staff on this year's budget. Unfortunately, last year, we weren't able to meet and talk to everyone. So this has been a wonderful opportunity for me as a brand new council person to actually get to know the different intricacies of the different department within the city. So thank you, and thank you to your staff. And Ms. Lopez, congratulations, keep going. I want to hear about more, child care center I want to hear about more small women businesses. I am more excited more than anything else in that part of the recreation area. So thank you so very much. And Mr. Majority Leader, I think I'm finished up with my question now.
Thank you, Councilwoman.
You sure? Councilman Gale.
Thank you, Majority Leader, and good evening, Director Oliver and your staff. Just one question. I'm just wondering if there's been any progress made in trying to reignite recreation programs in our schools. What can you report to us on that front?
Yeah, we have, so we are working on some great plans for the summer. We were just meeting with Hartford Public Schools this afternoon to continue to work on that. So we will be in the school facilities this summer and also bringing in partners as well. We hope to have more of the actual final details on that to you very soon, Councilman, that we can share with all of you. But I can tell you it's been a great partnership. And I think, as someone said to me once, the tarnished silver linings of COVID, this is one of them for us to say, look, we got to really serve our kids and put our kids and our families first. And this is something that's actually happening. So thank you so much for your continued support around this. And you'll be hearing much more very soon.
Certainly looking forward to it, and you'll certainly get continued support from us. Thank you.
Thank you, Councilman. Question, what are the hours of the rec centers going to be this summer? Are they going to be, I know we've talked about this every budget year now regarding the extension of our rec centers, just to make sure that our youth and more so all the young adults as well have a place to go versus just always being on the street. So are there going to be any extended hours during this time?
Yes, there will be. Thank you, Majority Leader Clark. The answer is yes. So right now we are planning a program that will be Monday to Saturday, 4 to 8, specifically for those young people. So it will be at 4 locations that will include our big rec centers that we talked about a little bit earlier in terms of Arroyo and Parker, but also 2 school facilities. So that will be across the city. So again, more to come on that. During the morning hours, the reason it's not fully like from 8 a.m. to 8 p.m. is because we do have some plans for some camp activities, et cetera. And honestly, the young people tell us, to some degree, don't bug us until the afternoon. And then also some of them will be in some of the extended summer programming with the school systems. But that is something that we're bringing back. And a couple of years ago, we were able to engage about 537 young people in a similar program. And we had to learn a lot from them, quite honestly, in terms of what worked and what didn't. And so that is with recreation, one of the many programs that's coming out of Troy's shop. So again, we are finalizing that just today. I mean, we had a great conversation. And when I say conversation, no, this has already been at the mayor's office, superintendent's office. And so now we're actually executing and getting the work done. So we're at a place of is more so of just making sure we got all our logistics and scheduling and all that good stuff taken care of at this point. And so again, we'll have something for you very shortly and for the community.
It sounds good. Is there any money in this upcoming fiscal year's budget for movies in the park?
So Movies in the Park is officially not our department. I believe it ends up being under Department of Development Services, under special events. But we are always supportive of Movies in the Park. Troy and the team will take on anything. We'll take advantage of anything, but we'll make sure to pass on that question and get that answered.
Thank you very much. And lastly, since I know many of our students are going back into school, and then there was the opportunity for the learning hubs. Is that is that still continuing?
Yes, it is still continuing. What we did was when Hartford Public Schools brought their children back in, what we did was extend it from a before and after school program, which was really helpful to a lot of parents. I will let you know, we're about to have some in-depth conversation with each one of the providers because we are seeing slowly that utilization becoming slower and slower. And part of it also, quite honestly, is the weather is getting nicer, right? So now, you know, it's like, hey, I can go and go to the parks, right? We want everybody to go outside and have fun in our parks. So we are working on that right now, but we do have children who were in our programs. I mean, in particular, Boys and Girls Club had, you know, over 100 young people there they began working with. And while we do have seen some of our attendance roll down, they continue to have a significant amount of kids. So the program is still going. We did have to modify, and it, you know, it's one of those things where when we asked parents, "Did you still need us?" They were saying yes. So we stayed there and stuck with them.
Okay. Thank you very much. Any other questions from my colleagues that is on the call? Seeing none, you all did a great job. Thank you, Kim. Please continue to keep up the good work. Thank you to Christina and Troy and to, oh Lord, I'm sorry.
Ms. Lopez.
Yes, I can't. I know the last name. The first, I'm tired. Charge it to my head. Shailene, there you see.
Yeah,
Nobody had to help me either.
it popped up, right?
That's right. That's right. Another person I go way back with as well. So, and also Troy. So thank you all. You all doing a great job, and please continue to keep up the good work. Please don't hesitate to reach out to us if you have any questions or assistance that you may need. To our viewing audience, thank you for viewing in. This OMBGA budget hearing is now officially adjourned for the night. We will come back on Monday. We have our council meeting. Public comment starts at 6 o'clock. Our council meeting starts at 7 o'clock. Thank you all. Have a great night.
Have a good
Good night,
night.
everyone.
Good night, everyone.
Good night.
Night.